Not by me. This was a disaster of a mistake. It all went wrong when the clip fell off and I buzzed the top real short. It went to hell in a handbasket, let me tell you. Oh, it did not work out well at all. I'll let my 11-year-old daughter give me a haircut next time.
Morning, everyone. Call the meeting to order at 9 o'clock. We will now have a moment of silence, silent reflection, silent prayer. Thank you. Supervisor Villapudua, will you lead us in the pledge? Thank you. For the record, this is the special meeting of the Board of Supervisors of Tuesday, April 14th, 2020. Will the clerk please call the roll?
Board Member Villapudua. Board Member Patty. Patty.
Yes, here.
Board Member Wynn.
Here.
Board Member Elliott.
Here.
And Board Chair Miller.
Here. Thank you. First, I want to announce that effective immediately and while social distancing measures are imposed, the board chambers are closed to the public during these board meetings. There's a couple of alternatives for the public to watch these. You can see a live stream of this meeting on the county's website and also on YouTube. Now's the time for public comment, and public comments are being received limited to 250 words or less, and they can be submitted by sending an email to the clerk of the board at cobrecords@sjgov.org. Please, no personal attacks. We will make every effort to read all the public comments that have been received during the board meeting. But some we may not get to due to time limitations. However, all of them will be entered into the official record on file. Comments made on YouTube are not considered part of the official record and will not be shared with the board. So at this time, I'd like to ask the clerk if we have received any public comments.
Yes, Madam Chair, we have received about a dozen public comments and a couple of letters that I will go over. Our first comment is from Ken Campbell, and he writes, previously, I emailed about allowing private clubs to open for golf with safety provisions. Per your instructions, I emailed the state health individual. I never got a response. Meanwhile, Sacramento County is allowing golf, as is Madera and Amador. Can you re-examine your decision? And he goes on to state in a second email, once again, I asked the county to approve the opening of private golf courses with appropriate safety rules and considerations. Sacramento, Amador, and Madera counties have opened their golf courses and implemented sensible and easy to follow rules. This week, 20 people from Lodi went to courses in Sacramento to play golf. They would rather have played here. I'm 73 and did not go to these courses. I've honored the pledge to stay sheltered in place. I would play at Woodbridge CC if reopened, as I know the previous rules worked. Golfers naturally stay apart from one another, as that's common courtesy. The economic impact on our club is also a consideration, as I'm afraid too many people will drop out and harm our financial situation. Not much else I can say other than my mental health isn't being helped by being idled. Thank you, Kenneth Campbell. And previous Supervisor Carlos Villa-Pudua submitted a letter, which will be on file with the clerk of the board's office. And I'll read the first paragraph, which summarizes the purpose of his letter. It says, Dear San Joaquin County Board of Supervisors, as a former member of the Board of Supervisors, having served alongside several of you during my term of office, I am writing today to strongly urge the county to allow real estate professionals to go back to work under the essential services exemption. They are currently listed as under the United States Department of Homeland Security, with the appropriate safeguards in place to protect the public during our current COVID-19 crisis. Blake Byerly writes, to whom it may concern, the purpose of this email is to appeal the decision to close golf courses in San Joaquin County and respectfully request they be reopened effective immediately. Neighboring counties have not closed their courses, and it is forcing players, club members, such as myself, to play those courses rather than the ones we prefer to play in our own backyards. Of all sports, golf is the easiest to implement social distancing, as it is built around individual play. Please note we will continue to appealing the county's decision to close our courses, as we feel very little thought, much less logic, was put into this decision. Jennifer Hammerstein, I will read a portion of her email comments as they exceed 500 words. She writes, Dear Board of Supervisors, my name is Jennifer Hammerstrom. I am a resident of Tracy. I am writing in regards to the golf courses in our county being closed. I watched your meeting a couple of weeks ago when the county health director decided not to reopen our golf courses. I understand at the time that Sacramento was the only county that still had their courses open. Since then, multiple counties have reopened their courses. I think we can all agree that this horrible event to our society has gone on longer than we thought it would. What I didn't understand was why the health director thinks she knows better than the other doctors and county health directors in our state. Dr. Park is now being unreasonable. The community is using the golf courses as a park to play catch, walk their dogs, etc. Playing golf on these courses would be no different, especially the private member courses. There is no need for the golf shop to be open since it is private and members pay a monthly fee. Therefore, there would not be any reason for golfers to come in contact with any employees or in a small area. Bryce McAlpin writes, I just wanted to inquire as to the reason for the golf courses being closed. Sacramento County has kept all of their courses open and deemed golf an essential service. Why are we more locked down than they are? We need something to do. Thank you for your time and happy Easter. And John Beckman submitted correspondence on behalf of the BIA of the Greater Valley, and I'll read a portion of his letter. It's regarding residential construction and home sales as essential services. And he writes, Chair Miller and Board of Supervisors, on behalf of the BIA, I am asking for clarification that residential construction, the purchase and sale of homes, and the services necessary to facilitate the same are and remain an essential service in San Joaquin County. He goes on to state, additionally, we ask for clarification on how the process of selling and purchasing of real estate should continue in a safe and healthy manner. One recommendation would be to adopt the very restrictive language used in Bay Area counties. He asks that you please accept the recommendations as the most appropriate and efficient way to address both crises facing San Joaquin County. We need to keep our residents and workers safe, and we need to continue providing housing, shelter, and good jobs to our residents. And his correspondence and additional submitting documents will be on file with the clerk of the board. And Mr. Beckman also submitted a letter on behalf of the Lodi Association of Realtors, and I will read this letter. It says, Dear Chair Miller and Supervisors, on behalf of the Lodi Association of Realtors, Inc., I am asking for clarification regarding the sale and purchase of real estate in San Joaquin County, and specifically on the processes of how we facilitate the sale and purchase of real estate. Both the federal and state government allow the purchase and sale of real estate, and even the very restrictive health orders from the Bay Area designate the following as essential services. And they go on to provide the wording that the Bay Area uses for the sale of residential transactions. It says the economic impacts of this pandemic are creating significant societal issues. The ability to change residences, including buying and selling real estate, is critical to the health and well-being of our communities. I ask that you continue to allow real estate transactions and provide further guidance on how these transactions are to be conducted, similar to the language provided from Ed Ugarte, President of the Lodi Association of Realtors. Next is a comment from Jerry Nasoy. They write, it is high time we come to our senses and get things moving again. As a nation and as part of the human race, we have suffered through many pandemics, wars, viruses, diseases, and various illnesses, and have managed to survive without isolating and shutting out our friends, families, and the entire world for that matter. Playing golf is safer than going to the grocery store and a healthy, outdoorsy way of being social while mitigating and staying safe. You can put suggested guidelines together that can be followed while keep folks safe. I urge you to allow golf courses to reopen and other businesses that can safely mitigate. Stores are doing it, essential businesses are doing it. There's no reason that other businesses can't do it too. It is good for our mental health as well as physical health. Thanks for your consideration. The next comment is an anonymous comment and writes, Board members of the board, since the COVID-19 crisis started, my department, probation, and this board had been very slow to take action and protect its employees. During last week's meeting, the board approved a 5% supplemental pay for those as us working. However, the department has decided that only some employees can get the supplemental pay as their work is considered essential. The department has also elected to allow some employees to work from home in a rotating schedule. But this, once again, does not include all employees. Employees are being told they are essential, but their work is not essential enough to receive the supplemental pay. How can one be essential and not essential at the same time? Some employees have requested protective equipment and they have been denied. Employees are still congregating and some are even traveling, flying out of the county, increasing our risk of infection. How can I feel safe coming to work when the department isn't doing enough to protect us? And Barbara Paragan-Perea writes, Dear Supervisors, we have had an increase of 50 COVID-19 cases in the last 36 hours with 17 total deaths. While our curve will fall later on the state's timeline for cases peaking, our mortality rate is already too high for the percentage of cases at 5.5%. San Francisco County has had 956 cases with 15 deaths. In other words, they have 3 times the cases and fewer deaths. Even LA County, with the highest number of cases, has a 3.2% mortality rate. What is the cause difference? Has testing been too slow and too selective? San Joaquin County has a young population. Will the board and county administrators commit to a comprehensive review of how policies, procedures, spending, and decision-making processes have impacted the response to the pandemic, including higher death rates? Do you think it is time for a review, rethinking of public health administration and policies? The first duty of a public official is to serve the public good for all people. Public health is the cornerstone for all the county does, including promoting a sound economy. How do you as a county supervisor plan to do better for our residents? And the next comment is from Kimberly Wormsley, who writes, Hello, my name is Kimberly Wormsley. I reside in 95206 in BOS 1 district. I am submitting my comment and concerns about the direct effects that COVID-19 has on mental illness and the availability of mental health services within disinvested families. It has come to my attention that there continues to be a significant decrease of availability of services, in particular services that were formerly provided by community-based organizations. I continue to be concerned and thus compelled to inquire about the lack of mental health services that are available, especially during a very vulnerable time. As the county is shifting the roles of healthcare clinics to areas where community members suffer the most, how can we be assured that community members will get their needs met? As a county, we must continue to combat the residual effects of trauma and ensure services are available to all during this tragic turmoil we face. We have lost young, precious lives due to undetected depression, grief, and loss. Where are the services? Are there clinicians available? Why dollars and monetary support that were, I believe she meant earmarked for community-based services not being allocated to the appropriate CBO? We must act vigorously to intervene during real estate situations such as this one. And a final comment from Deborah Angelo writes, Good morning. I am writing to inform you on the importance of keeping the Manteca Clinic open. My husband and I use the clinic on a regular basis to stay healthy and monitored for our medical needs. It has been very convenient as we live in Tracy. We were horrified to learn that the clinic might close. We need access to our doctors in Manteca and the professionals she refers us to. Please understand that in the current situation the county is in, I think the clinic is seriously needed. Thank you, Deborah Angelo. And I have another comment, I believe, from Dave regarding the Manteca Clinic, but it does cut off, so it looks like he sent it without finishing, possibly. It simply says, Hi, my name is David Angelo, and I am portioning. And the subject line is Manteca Clinic. And that is all the comments.
Okay, thank you. Those will all be entered into the official record, and we'll try and get quite a few of those comments and questions answered during the course of this meeting. First up on our consent items is Health and Human Services. I'm going to ask Chris Woods to come down, our Human Services Agency Director. This is to authorize county departments to apply for and accept funding in response to COVID-19. authorize planning and preparedness efforts in support of San Joaquin Project Room Key. So, Mr. Woods, will you give us an update?
Yes, good morning.
Thank you.
And I just want, again, this is just really an update in terms of, I just want to provide an overview of the local efforts that have been undertaken to plan and implement for a Project Room Key in San Joaquin County, as well as some of the challenges and potential risks involved with taking on such a project, and also to give an opportunity for a touch point to secure any input from the board and any additional direction you wish to provide. I do want to just clarify that in the recommendations, I'm asking for authorization for departments to apply for, accept any additional funding that may be available. There's a lot of moving parts to this, and one of those elements would be, for example, the Human Services Agency reaching out to the California Department of Social Services to secure additional funding once a project is outlined and formalized. But in the recommendations, one of those is requesting authorization of the Director of General Services to negotiate a lease agreement and bring that to the board at a future date. I want to clarify that is currently being undertaken at the level of the Assistant Director of General Services, so it would be the director or designee. But I'm not recommending that an agreement necessarily be brought to the board retroactively. So I think it's a significant point that we need to have work be ongoing and then bring that to the board. I don't want to obligate the board necessarily to committing to something that has significant risk. I want to be very upfront about that. So just in terms of the overview, Project Room Key, it's the now known as statewide as Project Room Key. The state sort of laid out this plan. I've explained to this board in prior meetings to provide non-congregate shelter to individuals who are homeless, who are potentially asymptomatic, but need the ability to self-isolate based upon their age or comorbidities. Those individuals who are symptomatic or COVID positive, again, to self-isolate, protect themselves, and protect the community. So the goal of the project is really to provide that isolation capacity as a means to protect human life and to minimize the strain upon healthcare systems. In terms of the local effort, there's been a tremendous effort in terms of standing up a task force to address this project. The task force, and I just have to read, the various county departments, including HSA, General Services, Office of Emergency Services, Healthcare Services, the District Attorney's Office, Public Health, County Administrator staff, San Joaquin General Hospital staff, as well as staff from the City of Stockton, Community Medical Center, Dignity Health, and others. So there have been a number of meetings over the last few weeks to try to evaluate this project and develop plans and processes to support a local effort. And I think I shared with this board in the past the task force in evaluating where to place a non-congregate shelter location really looked at where are the homeless now and where are the service providers located. We have the two largest shelters in the city of Stockton, as well as approximately 60% of all homeless individuals in San Joaquin County residing in the city of Stockton. So the city of Stockton seemed like the most appropriate place to, one, support the shelters, and two, meet the need where the need is. In terms of securing the site, I think there's been tremendous effort put forth by this task force to develop procedures and plans, but we can't do anything without a site. And there's been tremendous effort to evaluate the sites that the California Department of Social Services has presented to us as a county as likely sites meeting their criteria to support this type of operation. We continue to work that list. Those conversations and those efforts have occurred and changed direction numerous times. Part of that is because the state really sort of laid out this framework in the beginning, that they were, again, going to be taking over operation of an entire hotel and providing that hotel to us to manage. And again, that was completely off the table. That completely changed. But the state did send out agreements to hotel chain operators, sort of laying out an expectation that counties would be taking over entire hotels and paying for every single room, regardless of whether it's occupied or not. That is not the case. And while the county could certainly do that, obviously it provides significant risk, financial risk, and any FEMA reimbursement eligibility, FEMA can reimburse up to 75% of costs. Vacant rooms are not eligible for FEMA reimbursement, so those funds expended for any room that is vacant would be borne by the county and its funding sources as a result. So sort of wanted to lay out the land that the scope of the view of the land that says that the project has changed tremendously since the beginning. There were false expectations provided to hotel operators, which have sort of complicated efforts. Suddenly, hotel operators may not be necessarily as interested in taking on this project when they know that they're not going to be reimbursed 100% for 100% occupancy. So again, one of the most critical elements of the project is securing that site. The Assistant Director of General Services has done a tremendous job reaching out to property owners, trying to navigate that process, and receiving support from County Council, as well as the task force in terms of, one is selecting a site that meets the criteria, and then two, in particular through County Council, trying to assess risk that may result from this effort. So in terms of, maybe I'll stop there and ask if there are any questions of the board.
I have a question, Mr. Woods. I know that up to 75% of the costs for occupied rooms may be reimbursable from FEMA. What's the timeline typically on receiving that reimbursement?
Chair Miller, that's an excellent question. And typically what I've heard through our partners at OES is it could take up to 2 years to be reimbursed.
That's what I was hearing as well. And so it doesn't mean we don't want to do it, but it is definitely something that we have to prepare for because we will have to carry that cost. Are there any other potential partners coming in with actual cash to help with the cost and the operations of running this program?
So certainly, I think there is, and there'll be an item before the City Council tonight where the city is contemplating the possibility of contributing up to $650,000 of their SB 89 funding that they received. They received over $1 million from SB 89 to address homelessness issues related to COVID within the city. So the $650,000 that is potentially contributed from the city could be matched with the SB 89 funds that the county has. The county was awarded $471,729, as well as the San Joaquin Continuum of Care has made available $102,547 of their funding towards this project as well. So in terms of what is secured now is only $574,276 from the county and the COC.
So is the SB 89 funding, is that also tied to this criteria in terms of the population served, that it can only be for folks that either are at risk requiring isolation or have already tested positive or are sick but don't need hospitalization? Or is the SB $89, is it broader so it could provide more relief just for the shelters for their overcrowding situation?
That is correct. So the SB $89 are sort of the HHAP lookalike dollars. They were allocated based upon the same funding structure, and they could be utilized to support shelters, expand shelter capacity, support homeless encampments, for example, with portable toilets or hand washing stations. They could certainly be used for other efforts outside of a project room key effort. So the only funds that would be specifically allocated to and need to be used for a Project Room Key would be any additional funds that HSA was able to secure through the $50 million set aside that the state set aside that we would need to apply for once we have a project designed, articulated, and a budget developed. And at that point, whatever that budget hole is, we can request funding to fill that budget hole. So this money, even the money that the county has received from SB 89, that the COC has received, the COC, for example, has only set aside $102,000 of their portion. Their other portion they actually put out as a notice of funding availability to organizations in the community to apply for. Those applications were due on April 10th, but to serve this need as well in other ways in the community.
Okay, I have a request to speak, but it's not showing who. Supervisor Elliott.
Thank you. Now, you had mentioned that the efforts to find hotels and motels that would participate in the project have met some obstacles here, less interest in participating. But my question is, how many are we looking at? When you look at these categories of people who would be eligible, you've got people who have already been exposed, tested positive, and you've got people who are just in the high-risk categories of having problems if they did contract the disease. So are we looking at keeping those in separate hospitals, or are we talking, or not hospitals, separate hotels, or are we looking at putting them all in one hotel where you've got people who have already tested positive along with those who are at very high risk?
Supervisor Elliott, through the chair, it's an excellent question. Actually, no, the state has articulated to us the desire to separate individuals who are symptomatic and or positive from the populations who are in that at-risk category. So that's one of the complicating factors also in selecting a site, is if even getting down to ventilation systems. The ventilation system has to be appropriate where it evacuates, and I'm probably using the wrong terminology, but evacuates the air outside, directly to the outside of the room as opposed to recirculating air, and ensuring that we are not mixing populations. So a hotel property that perhaps with doors that face outward as opposed to a property with doors facing interior to interior hallways where folks would come in close contact with each other. So the intent is to keep those populations separate.
And are we having any better luck here with our outreach in terms of trying to find hotels or motels? It sounds like if you're talking about doors that open to the outside, it sounds more like motel, although there are some hotels that have the doors open to the outside as well. Are we having any better luck with our outreach here? Have we even a smaller hotel where it might be easier to obtain close to 100% occupancy? Are we getting any interest?
So that is an element that we're actually working on just this morning in terms of pivoting and looking at properties that would may provide us that opportunity. Yes. So I mean, you're spot on.
Thank you.
Any other questions?
And if I could just add to that, I think the state, I will tell you that with the state sort of flipping the switch on this process, I was on calls with the state, and the state insisted that we look big. I mean, they were looking at hotels. If we were talking about at that point a hotel that maybe had 40 rooms, their response was look for 300. And yet the rules, the opportunity, what they're handing us is very different since that conversation occurred. So I think we've had to be very nimble and pivot how we approach this to be responsive to our local needs, for one, and two, the funding availability and the risks associated with a local project.
Thank you. Is there anything else, Mr. Woods?
I would just There's so much in my head. I'm sorry.
Go ahead.
I want to be clear that I don't take this lightly as the Human Services Director in terms of exposing the county to risk. I don't want to do that, and I do want to share and be clear with this board that any costs to repair a hotel, and it's referred to as like repair condition, so that condition that was most closely to the hotel that prior to occupancy, any costs associated with repairing the hotel are the responsibility of the county. And at this point, I can't estimate what those costs could be. I know that it is a significant concern in other counties. I've reached out to my counterparts in other counties. That's a significant barrier, as well as just citing the hotel in a community and some of the concern about from the community when that hotel is being located. So.
Thank you. I have another question from Supervisor Patty.
Thank you, Madam Chair. Are we restricted to only a hotel? And the reason why I ask the second part to that question would be I've seen on television, and as many communities are dealing with different challenges, they've put up big spring tents with individual living areas. And wondering if we could utilize the same funding to create a large structure that would facilitate 100 plus people is easy what I've seen them put up in quick order. So I'm wondering if that's something that's a viable option for us. It would bypass responsibility for hotels, damages, replacing furniture, and things that are obviously at risk of costing a great amount of money. So what could we do as it would apply to a structure, a spring structure?
Certainly, Supervisor Patty, through the chair. It is certainly an opportunity to do that with the funding that's available. We've communicated, and I've expressed to the city of Stockton in particular that they can certainly use their funding that's available to them to expand shelter capacity, and that could be a viable option to do that. And the state has specifically said that the most effective methodology for providing isolation capacity is a hotel motel type project. But with the challenges that we're talking about today, and that you certainly understand, we may need to potentially pivot to that type of operation. If we do that, the funding that we have available to us today from the COC potentially could be at jeopardy. That would be something for the COC to consider. The funding that the county has available for SB 89, I believe, could be used for that.
I know that it seems like you're in a catch-22. I mean, they want you to have 140. You look at 140 rooms, and you're looking smaller scale. But only as people are admitted would you get compensated. So you can have 40 rooms. You can have 20 rooms. And you may only have 2 people inside, and then you're going to bear the burden of 18 rooms that are unoccupied until they start to get populated by necessity, which may or may not ever show up. So I think it's you're in a difficult position, and I would start to think you might want to look at alternative options, that we're not sitting around waiting for just the right thing to work out. Where talking with a couple of the hotel operators that I think you guys have been dealing with, they need a guarantee. And we can't certainly give one. We'd be on the hook for that kind of money. So what's the next best option? And looking at these spring tents and what they were coming up with they had individual living quarters, and they had it was easy to quadrant off a population, and ventilation. It was easier. I think it was easier to manage versus everybody having individual rooms and being spread out if you're all underneath one structure. So just something to consider that you may go forward looking for the location to put a spring tent and move forward with getting one.
Certainly. And I think that if we're looking at a smaller location, we're going to have to make a priority in terms of who is our priority to go into that location. For me, and I think that our healthcare personnel folks would appreciate, I think our priority would be those folks that are COVID positive, that don't need hospitalization, so that we can ensure that they are not sitting in the hospital taking up a bed that's necessary for someone else with a higher level of care. And I think the spring tent could certainly be a viable option to expand shelter capacity and isolation capacity for those folks at the shelters who are not symptomatic or not, but they're at risk, but not COVID positive. Mm-hmm. Yeah, you're spot on.
Any possibility you could come back to us by next week with that option and under consideration? Maybe things will develop that show one way or another is better, but I think we need to move forward and not have kind of paralysis by analysis and changing circumstances coming out of Sacramento or Fed. Let's look at what we can do proactively that would solve that issue and prevent the spread to a vulnerable population, which could then become overwhelming for our local hospitals.
I think we can certainly explore that and potentially come back to the board as early as next week. I do want to clarify, though, that in terms of expanding shelter capacity, those requests through the shelter to support additional shelter capacity are currently going through the city's Emergency Operations Center. And if they need additional support to implement such an effort that is outside of their ability to fund those efforts with their SB 89 funds, for example, those requests would be elevated to the county's Emergency Operations Center. So there is a significant amount of coordination that needs to occur, and those conversations have happened at a very high level.
Sure, and I've had conversations with Wayne Richardson over at Gospel, as well as Jolene at Stockton Homeless Shelter, and their problem is room. They don't have areas to expand where if you're looking at something that might take 100 people, it would be maybe a safe number, as once they were saying 300 and now it's less. And if your projections and talking with Dr. Park or other people, you may have an indication of what your target would be. But let's say we're 100. I don't believe any of our current facilities would be able to take in 100 people. I know that Gospel Rescue Center has an area that could hold, I think in the conversation, like 6 or 8 people.
Yeah, it's very small.
Yeah, it's very small. So
very good job.
If we need numbers, I think we need to start looking at what we can do and where could we put 100 people or 120 people and utilize some of that dedicated funding and put together a viable option for consideration and just weigh out, what's the best use of that funds to actually get something open and implemented to, again, safeguard a vulnerable population.
Certainly. I think the task force that has been put together for this effort demonstrates it takes a whole host of individuals and teamwork, and we'll continue that effort. And we can look at partnering with the city and evaluating what we can do with exactly what you're suggesting.
Excellent. Thank you.
Thank you. Any other questions for Mr. Woods? Supervisor Wynn.
Thank you, Madam Chair. In the past, we have, as a board, talked about the larger capacity. We were talking about military tents, things like that have more space for more individuals to have beds in. And what Supervisor Patty has raised, and I guess a couple of questions, is one, it would seem like if we did build although it would be a temporary facility, there is a possibility, I'm assuming, based upon the location, that may be able to stay in place after this is over to continue to house those particular individuals. One, that those who test positive and those who are at-risk individuals. So I guess, and I, following Supervisor Patty's thoughts, would that be a possibility? And if so, especially in the COVID portion of it, where you talk about reimbursement, how do you categorize? If you followed the tent city in Modesto, that's had its pros and cons in regards to individual locations. So I guess, and I would agree with Supervisor Patty in regards to at least looking at the possibility, not only from the standpoint of the current crisis and the pandemic, and certainly what we're dealing with, but also for future utilization of these facilities to continue housing homeless individuals as opposed to having them return to their encampments or wherever they happen to go. So I guess the reimbursement aspect of it, certainly the potential for longer term utilization. And then I assume it applies to both the hotels or motels and whatever we come up with. But as far as the care, or at least the attention from the medical community as far as making sure that these individuals, certainly the at risk, but then on the other side of it, the COVID-19 test positive individuals, on how we oversee that to make sure that both sides are being protected or taken care of.
Supervisor Wynn, through the chair, that the case management services, supportive services, that is where it is incredibly complicated, and as you can imagine, trying to design a system without experience, for one, but two, trying to do this in a very fast-paced situation. There's been a tremendous amount of work to try to lay out what that process looks like, the proper protocols, the support, the assets that are all necessary to do exactly what you just mentioned, and to secure individuals, support them, and ensure that they're not intermingling and infecting other folks. It's a tremendous lift that's taken a lot of partners from our healthcare community to get us to where we are today. And I don't even have a plan to present to you that is in a presentable form. And to be in that situation with all of the work that has gone into this, I think exemplifies how complex this process has been. We're trying to get there, and
Thank you.
It's been quite an effort on the part of a lot of individuals. And if I get to share that, and I did want to mention that the county's received a little over $500,000 in SB 89 funds that could be utilized for projects throughout the county. The city has also received a little over $1 million for this type of effort that can be focused within the city of Stockton. So there are a lot of local resources available, and it's going to certainly take a partnership to implement something like a spring tent within the city of Stockton. And when I say partnership, not only effort, but it's going to take resources as well.
Thank you.
Thank you. Anything else? Okay. Then I'm looking for a motion and a second to approve this consent item.
And I'm sorry, and I just clarify in the recommendation, if it's an important distinction, that the assistant director is currently, of general services, is currently doing the negotiations on behalf of the director of general services.
Excellent. Thank you.
So moved.
Second.
Okay, we have a motion and a second. Please cast your votes. And that is approved, 5-0. Thank you. Thank you for all the collaboration and teamwork that's going into this. I know it's been difficult, but we appreciate, on behalf of some of our most vulnerable residents, all the work that's going into this. Okay, now I'm going to recess the Board of Supervisors meeting, and I'm going to announce that this board will now be acting as the governing board of the In-Home Supportive Services Public Authority, and I'm going to convene the In-Home Supportive Services Public Authority meeting. And we have a consent item. I'm going to ask Mr. George McHugh to come down. Our consent item is approval of the revised public authority budget and budget adjustment in the amount of $183,000 to purchase personal protective equipment for IHSS providers. A 4/5 vote is required. This is coming to us based on direction received from the board at one of our earlier meetings. Mr. McHugh, welcome.
We had about $183,000 in unallocated state funds that have been allocated to our county, unallocated by us, but the state allocated them to our county. We did not budget to use them. And a number of counties are providing PPE to their IHSS providers. San Francisco comes to mind. Vast majority of counties aren't doing it because they are looking for funding. Last week, the state announced they are distributing 500,000 masks and gloves. I don't quite know what they mean that means a box of gloves or just 500,000 gloves. And those are intended only for providers who are caring for people who have tested positive or are self-isolating and presumed to be, they're symptomatic and presumed to be positive. Our county's share of that will probably be about 3,000 masks. So we're not sure when they say are, like, are they, what they're assuming the percentage of the population will be affected. The counties that are trying to provide PPE are either using amounts that they already budgeted in their agreements. Other counties have come up with funding. San Francisco is obviously one that tends to spend a lot on that program. And in a number of cases, counties have partnered with the unions to acquire and distribute them. Well, but for majority, people are still looking to the state for guidance, and the state has talked with public authorities and our associations, both CSAC and CAPA, about coming up with some funding, but they're still working that through. I haven't heard anything as far as progress on that goes. For the public authority, we're mainly focusing on establishing an emergency backup provider program. State is going to pay an additional $2 an hour for providers who will go out to replace a provider who is unable to continue working for a reason related to the COVID-19 pandemic. We are working with we have about 500 registry providers right now, so we're working through calling them. Union has been calling. At first it wasn't that helpful because they were calling everybody and telling them you get another $2 an hour, which is quite how it works. But we did get them a script, and so they've been partnering with us on that. And they have registry applications for people who aren't currently on the registry that so they can apply to the registry, and we'll work to process those applications as quickly as we can. And we are continuing to improve our capacity to remotely process providers and get them onto the new providers and get them onto the payroll system. The state has given us some flexibility, which will speed that up. And we will be working with a new web service that will allow providers to complete orientation online and us to collect paperwork online, which will be even faster. Currently, the main limitation on orientations is just bandwidth. We've tried the different programs, but right now we're using the county's WebEx program, and it just can only, when you're showing a video, you can only have 2, 3, maybe 4 people on the program at a time. That's mainly where our focus is right now, on getting those things set up. We would like to get PPE, which was suggested by your board. The states, the way I look at the states wanting to protect people after the fact, but we're trying to protect people before the fact. So if we go ahead with this, that would be the goal. We have some criteria, live-in providers would need it unless, I believe they would need it if they were symptomatic or tested positive. And then we would be able to give providers, we would control the amount of masks and gloves they get based on how many people they care for. There's about, for example, there are about 800 people that care for 3 different recipients. And so we want them to have gloves and masks for each recipient. Any questions?
Supervisor Patty.
Thank you, Madam Chair. So the $186,000 is to procure some PPE, correct?
And I apologize, there was an editing error. It's $183,000.
Okay.
So we changed the amount after HSA reviewed the finances, and we just missed that.
Is there a breakdown on what you're actually purchasing, how many items, and at what cost?
I haven't filled that out yet, but I believe I'm going to spend about 80 to 90, about 80,000, maybe 85,000 each on gloves and masks. And The rest will be spent on hand sanitizer.
But you haven't sourced the pricing, or you're not presenting
Yes,
a
there's an
proposal.
order that's supposed to go out today, so we've been working with purchasing to get that set up, and I will submit that as soon as we're done here. And it looks like about a 2-week turnaround time for the items we'll be purchasing.
Okay. Just out of curiosity, if I can get a copy of that purchase order, so I could see what rates are being paid for which items?
Yes, sure.
Okay.
Happy to do that.
Thank you.
I have a quick question, Mr. McHugh. So this $183,000, we anticipate that's going to be enough to provide the necessary PPE to our IHSS folks?
I have to be honest and say we don't really know. When we've had the small amount that's in our contract, which has been about $5,000 a year, we've been spending. There are years we use it up. There are years we don't. I think because of the awareness, we expect to use more. It could be enough for a month. It could be enough for 2 or 3 months. But I don't think we'll be able to predict until we see how many people are coming out to get it.
Okay. Thank you. I would just encourage you to keep a hard look ongoing at how it's being utilized, so that we don't end up in a situation where we use it all up and then we've got a lag time of 2 weeks where people don't have it. So if it needs to come back and we need to authorize more, I would just encourage you to really keep an eye on this. I think it's good that we're being proactive. We're not doing it after the fact, and I would like to keep it that way.
Yeah, I appreciate that very much. Saw a Twitter comment this morning from a woman who lost her mother to the virus, and then 3 days later, her mother's provider passed away, who had continued to work the whole time but had not had any symptoms until right after her mother had died.
Right.
Thank you.
Okay. Thank you. Anyone else? Okay. Then I'm going to ask the clerk, did we receive any public comments on this item?
No, Madam Chair, I've not received any further comments.
Thank you. Okay, then, this is a consent item, and I'm looking for a motion and a second to approve this amount for purchasing of personal protective equipment for our IHSS providers.
Move to approve.
Second.
Okay, we have a motion and a second. Please cast your votes. That passes 5-0. All right. I have seen here, my screen is a little odd today, but some board member requesting to speak. Did I skip someone, or everybody's good? Okay. Thank you. All right, then. We're going to move on to our discussion item for today. Oh, wait a minute. First, I have to adjourn our in-home supportive services public authority meeting and reconvene the Board of Supervisors meeting. Now we are going to move forward with our discussion item today, which is the point of this meeting, really focusing on updates on COVID-19 and to provide direction to staff or adopt orders as necessary. So first up, I'm going to ask Dr. Park to come give us an update.
Thank you, Chair Miller. I would like to give first some updates from our county team making efforts on COVID-19, and then talk a little bit about the new stay-at-home order, which has been updated and will be active as of today, and then end by discussing briefly the question about lifting restrictions and reopening our county. And when I'm done with my updates, I will introduce you to Mr. Chuck Davis, who will give us a presentation from Bayesiant on modeling that has been created for our county. So Public Health Services, Emergency Medical Services, and the Office of Emergency Services continue to work together to coordinate our COVID-19 management efforts. We're constantly monitoring our case numbers and the numbers of people who are admitted in area hospitals in order to assess our ability to meet the demands of a surge and a peak in hospital admissions. Our current case count is 314 confirmed cases of COVID with 17 deaths. Yesterday we did have an increase of 36 cases from the day prior, and this represents the biggest increase we've had ever in one day. But there's a reason for this jump, and that is because we have started to receive results from Verily. That is the drive-through test site located at San Joaquin General Hospital. That was a great effort put on by OES and is supported by San Joaquin General Hospital staff, which opened last Wednesday. Of course, with more testing happening in the county, it is to be expected that we are going to get more positives. And so we do know that these numbers will stay in that range over the course of the next couple of weeks. And the number that we really want to pay close attention to is not the number of confirmed COVID cases, but the number of people who are newly hospitalized. As I said, with increased testing, there will be increase in numbers, but we're really focusing on how many people need to be hospitalized each day. My communicable disease investigation team still has to get through all of the 36 new people who were added to the list yesterday. And I don't know out of those how many are in hospitals at this time, but I'm hopeful that because Verily is a drive-through testing site, that most of the people who were part of the number of 36 are at home now and are not actually in hospitals. We continue to create messaging for the public and to provide guidance. And that situation is frequently changing, so we make adjustments as needed. For example, advising the public for weeks against the wearing of face coverings, and then the CDC did a 180 on that recommendation, so we had to adapt and develop guidance on the proper use of face coverings. I want to thank everyone in the healthcare industry, first of all, as they are at the front lines of this crisis. And I want to also thank the Homeless Shelter Initiative. Aside from the hotel-motel task force that Mr. Woods was just giving us a briefing on, there is a medical assessment side to this, and it is really led by people like Casey Rain out of the DA's office and Tori Verber-Salazar herself, as well as Kristen Burtwhistle from United Way. They are meeting daily with shelter leaders and have set up a screening process which began last Thursday at the Stockton Shelter for Homeless, which registers 250 men or more on a daily basis. The screening includes temperature checks as well as symptom checks, and then education being given out to the shelter residents. As you probably can imagine, there is great difficulty enacting social distancing within a shelter, so it is an imminent threat, one that we're very wary of, the possibility of an outbreak in a shelter. But we are teaching proper hand washing and trying to teach proper behaviors. Of course, there are shelter residents who share cigarettes and share utensils and who are standing very close to each other within the shelters. So a lot of education is going on. This sort of screening process and education is going to be now moved on also to the Gospel Center Rescue Mission. All of these are really supported by staff from Behavioral Health, United Way, Stockton Unified School District, San Joaquin General Hospital, and Community Medical Centers. I just wanted to give you a little update on what they were doing. So far, the screening process has not led to anyone needing to be hospitalized. Now, on to the new order. This is the third rendition of our stay-at-home order. The initial order went out on March 21, and it was then updated on March 26th. And today, our order will be updated to include some things that we are specifically addressing. And we are issuing this order out of an awareness that the stay-at-home orders are likely to remain in place for some time, and with the knowledge that there's some amount of activity that businesses in San Joaquin County need to undertake to protect their investments. The order allows for businesses to engage in minimum basic operations, which is defined in a very lengthy statement, but basically is defined as a minimum necessary activities, the minimum necessary activities to maintain and protect the value of the business's inventory and facilities, ensure security, safety, and sanitation, process payroll and employee benefits, and so on and so forth. The trade-off to that is that if a non-essential business is going to engage in minimum basic operations, they must do so safely and responsibly by adopting and posting social distancing protocols. And the social distancing protocol would include such things as posting signage at public entrances, limiting the number of people in the facility, providing disinfectants and hand sanitizer, placing markings at least 6 feet apart where lines may form. This new order also addresses retail businesses who were directed to close at the outset but then acquired merchandise that they are now calling PPE in order to stay open. Those businesses will only be allowed to stay open if they were selling a significant portion of essential goods such as food, hygiene, and consumer household products before March 19th when the governor did shelter us in place. The order also provides specific direction for the real estate industry and for golf courses. And I know that this question did come up in public comments, so I will briefly address those parts of the order. And, you know, it can be read in full by the public once it is released, but just to let you know, we are allowing real estate to occur virtually. If virtual viewings are not feasible, then no more than 2 visitors from the same residence can visit a unit with one individual showing the unit as long as there are no current occupants residing in that residence. No open houses are allowed. So, of course, everyone is wondering when the stay-at-home order will be lifted, and I understand that people are anxious to get back to normal. This Thursday will mark 4 weeks since Governor Newsom sheltered us in place, and it definitely feels like an eternity to most. At this time, there's no one return date that I can give you, but I do know that it's going to be a gradual process and that Governor Newsom will ultimately guide that process. In the past couple of weeks, several different guidance documents and writings have been published with experts in the country laying out plans to reopen. These are plans coming from Johns Hopkins University, from Harvard's Safra Center for Ethics, from the Center for American Progress, and from Mr. Scott Gottlieb, who was a former CDC and FDA commissioner. So people are reading these lengthy guidances on how to recover and when can the whole nation start to venture out again, and I'm sure that our governor is looking at those as well. I know that the state's been looking also at predictive models in order to estimate hospital surge capacities. Early on, our models for California showed that we might be short 50,000 hospital beds at our peak, and hospitals were asked to increase capacities by 40%. As we heard from Dan Birch, our EMS director, last week, and as he will say again today, our hospitals have achieved this. Statewide, those efforts led to an increase of 30,000 beds for capacity. And in addition to that, elective surgeries were canceled and internal capacity was expanded in many hospitals across the state. And this really ended up giving us an estimated additional 40,000 beds. So it appears that California's curve is flattening and that our hospital capacity seems to be adequate. Things that are called non-pharmaceutical interventions, such as cancellations of mass gatherings, the cancellations of schools, and the stay-at-home orders, have flattened the curve. And yesterday I did receive notice from the state that our modeling now shows that because of the flattening, our predicted peak may be delayed until the second half of May or later. I don't know how this timeline with the peak moving back to late May is going to affect the governor's timeline when it comes to lifting restrictions, but my understanding is that he's going to be making some important announcements today in a press release, and that the response from California will be a shared response with the states of Washington and Oregon. So I'm looking forward to hearing more on that, and there's going to be a call with all the county health officers, with the state public health officer, going over this modeling and going over the roadmap for California's recovery. So I will be hopefully bringing back more information for you next week. What's exciting for me is that this timeline set out by the governor's office is really in line with the modeling that I've been privileged to have a look at through Bayesiant. And I'm happy to share some of the points that Mr. Chuck Davis will be bringing to you in this presentation and to talk more about them after he presents. But at this point, would like to welcome Chuck to the podium, the table, to go over the modeling that we have specifically for our county.
Good morning, Mr. Davis.
Good morning. I think they're going to bring up the presentation, but before I begin, I just want to thank the board for allowing me to present today, and a little bit of background. My wife is a physician in San Joaquin County. I'm a resident of Sacramento County, but we spend a lot of time here. She takes care of your constituents, and this is a wonderful place to raise a family. We thoroughly enjoy it, and when I had the opportunity to work with Dr. Park, we were providing a lot of resources, both on the state level and the federal level, several different states. And so I just wanted to thank a couple of people before we begin, because getting the data is difficult. Definitely want to thank Dr. Park. She's got a very, very difficult job in trying to manage this outbreak. I also want to thank her team, the epidemiologists. I've not had the privilege or pleasure to meet any of them yet, but all of the data that you see, they're the unsung heroes behind the scenes. They are gathering this data and qualifying it and normalizing it, and that allows us to make this presentation. And also Mr. Diedrich and also Mr. Birch, in terms of their ability and willingness to gather the data as well. So it truly has been a team effort. With that, I'll go ahead and begin the presentation. It's really an update we've provided. This is the fourth of three. This is the fourth. And the initial presentation was actually made 2 weeks ago. So there's a general disclaimer, and Bayesiant is providing the services to the county at no cost. So and lots of people have heard about models. What we're doing is we're using 3 different models. And we have our own model, which is a proprietary model that deals with population health. It's unique because my role as a data scientist, usually we're just looking at data. We're trying to figure that out. But my background is also in behavioral computational science. So what we're trying to do is figure out what behaviors are contributing to the data that we see. And so that's a very, very specific and specialized area of data science. And what we've done is we've actually built a model that looks at population. So the model is based on individual people, and that's very unique. The next model is something called an EMOD model. And the EMOD model is one that uses something called ordinary differential equations, but this is a standard model that's used in epidemiology. And so we had to write a specific module for it for COVID. And then there's the pin-chime model, and that's a relatively new model. That model was built specifically for COVID-19 by the University of Pennsylvania, and that model looks at essentially surge capacity and your ability to meet the demands of addressing COVID-19. There are 3 different models. They use 3 different technologies or methodologies, I should say. But when we use them, all of them are in relative agreement with about 2% variation with respect to hospitalizations. And this is important. I don't want to get into how the sausage is made, because I think I'd put everybody to sleep. But this is the best analogy I can make is this is like forecasting the weather, and a hurricane is coming, and you see the spaghetti charts, and they're using lots of different models, but they all tend to agree at some point. That's the same thing that we're doing here. You don't want to rely on one single model. You want You want to look at several models and see if they converge, kind of like doing a poll of polls, if you will. So there are some limitations in these models, and it's really important because I think a lot of people hear about models and they sound like a black box and, you know, kind of mysterious. And, you know, models are projections. They're not guesses. They're based on science, but they're projections. The most important thing in my role as a data scientist is not to just sit around and make projections, but to see how those projections line up with what's actually happening on the ground, or what we call ground truth, or what we call blue data. That becomes really important, and we'll talk a little bit more about that. But back to the limitations. We have to make an estimation of what we expect mitigation to be, and so for our model, we estimate that mitigation was roughly about 40%. At the time that we began, we had limited data with respect to ICU admissions and ventilatory support, and we had to make assumptions at the time about how long someone typically stays in the hospital if they're admitted, how long they stay in the ICU, how long they require ventilatory support or a ventilator. And we start with our in-size, which is the size of the county, and we also had to make an accommodation where there was no catchment from other hospitals outside of the county. Now, that's not really practical because the fact of the matter is people will leave the county to go to other hospitals. Maybe they'll go into Stanislaus County, or maybe they'll go into Alameda County. But just for the purposes of modeling, we did not include an initial catchment number. So what we're currently seeing now is a doubling time of 10 days. Initially, when their first cases appeared, the doubling time was roughly 3 days. So that's a pretty big deal. We're estimating that the number of individuals as of yesterday within the county that were infected with SARS are around 3,781. Now that number will continue to go up. And the current estimated R0 is 1.8. So the R0, even though people probably have heard that term, is essentially transmission. So that means that for every person that currently has COVID-19, it's expected that they would be able to infect, close to 2 people or so. I'll go into the summary findings. I guess the screens went away. Hopefully it's still streaming. But in any event, do you guys still see it on your screens, or it's gone? Okay. Maybe it's time to take
Mr. Davis, if you don't mind, I know ISD is working on trying to fix the connections, so they should have it ready in just a moment.
Okay. Maybe it's a good time for me to pause and take some questions based on what we initially saw.
Any questions for Mr. Davis?
Stalling.
Supervisor Wynn.
You talked about the R0 of 1.8.
Yes.
I know in the beginning, and I guess this is kind of the evolution of statistical data and information that's been submitted. But I know in the beginning they were talking about, normal flu was like 1.2, but the COVID-19 was estimated to be 5.7 as far as contagion. Obviously, your model shows that number has come way down to be almost commensurate with a normal flu contraction, so to speak.
Right. So there's been a lot of speculation about the R0. Part of that is we just don't have the surveillance with respect to testing, so we really don't know exactly how prevalent this virus is. Even today, we still don't, and I'll discuss more about that as we go through the presentation, but even today, we still don't know exactly. We can make these estimations. The best way to make them, as Dr. Park discussed, is by looking at hospitalizations, because that directly impacts what we're seeing. Those are hard facts. We don't know because we don't have robust serological testing to see who's been exposed. We couldn't do that early on because people, during the height of the outbreak, They might not. There's a certain amount of time between the time that they actually start to develop antibodies where they're actually testable, and we didn't have the test anyway. We still don't have the test in sufficient numbers. And then, of course, with the standard testing that you would do, nasopharyngeal testing, that's also been lacking. So as that starts to come on board, we're going to see more cases, and there will obviously be people in the population that have had COVID and recovered that were largely, their symptoms were relatively mild. They never had to go to the hospital. The hospitalizations are the ones that are absolutely critical, but at the same time, you still have people that might be asymptomatic that are spreading it. It does appear to be highly transmittable, but because we're starting to see the decline in numbers, we can say that the R0 is definitely coming down. I think we're back, so I'll get back to the presentation. So when we look at this summary, what we see is that within each individual region or county, there are going to be specific differences with respect to COVID. And the reason why, and COVID, when I say that, is the specific disease as a result of the SARS-CoV-2 infection. So based on the demographics of a particular community, how many people are older, density, you'll see a different curve. You'll see a different rate of mortality. I know that someone had spoke earlier about the fact that we're at 5% as opposed to someone else, and I'll speak to that as well. But the demographic composition of a region and the density of a region all contribute to the specifics of the manifestation of the COVID outbreak. So specific to San Joaquin County, and it will look different for Stockton, and it will look different for Lodi. There will be, and it will look different for Manteca. You'll see these community differences as well as you start to get granular. But this is obviously important for Dr. Park and her team, because the more granular you can get, the more targeted you can be in terms of your resources, and that will help us in terms of actually, turning the economy back on and getting going again. You can't do that unless you have that granularity. And so we're working very, very hard to try to provide that. So again, in terms of summary, we're seeing that the distribution between males and females within the county for confirmed cases is practically even. We're also seeing that the mortality rate is roughly 5%. Actually about 5.6% as it currently stands. That's actually higher than the states, with the state average, and it's higher, for instance, as someone had said, San Francisco, but there are reasons for that, primarily because we have a concentration of older people within our community as opposed to San Francisco. And so what you're seeing is the demographic effect that is amplified in terms of the people that are disproportionately affected by COVID-19, which if you look at the top graph, that bar graph at the top, you'll see that that a large concentration of individuals are typically over the age of 55. And then the individual cases by city are here as well, with Stockton being the highest and also being the most populous city. But there are, when you adjust for per capita, you can see areas that we would also need to concentrate on. Lathrop, for instance, being small, but still nonetheless, and Manteca. So initially, we start by creating a baseline. And so I believe that Supervisor Elliott had made a comment before about how the projections initially are unmitigated. Well, the unmitigated projection is where we would start. Because we don't know the effect of mitigation, we have to measure it. So the very first thing that you would do is you would say, what happens if this pathogen is allowed to just run rampant? And so the very first bell curve that you see off to the left, you'll see three independent curves. The first is the number of daily hospitalizations that we expect, and so these are resource curves. The one underneath it, and that one is 768 people being hospitalized in a single day throughout the county. The next curve underneath it is 230, and those are the number of people in addition to the 768 that would come into the hospital and immediately have to go into the ICU, and another 154 in a single day on top of that would need ventilators. And that's just in one day. That's a peak day. And then the curves to the right of that are the mitigation curves. And so those are the curves where we have estimated the effect of mitigation. And so we're saying for a peak day, 299 for hospitalization, 90 for ICU, 60 for ventilation. And you can see that one had April 30th, non-mitigation, and mitigation is moved out to May 30th. So almost a full month. So when you push down on the unmitigated curve, zero-sum game. What you're doing is it's kind of like pressing a balloon. Until the balloon pops, it just kind of expands and moves out. It kind of squishes. And so what we've basically done, what the constituents of the county have done, hopefully, and we'll actually show that, is by pushing the curve out, you're actually extending the time, and you're not getting that sharp bell-shaped curve with the sharp peak, because if that happened, you've completely overwhelmed the healthcare system. Once you go above a certain level, you just can't provide care, and now that's where you're facing huge amounts of mortality. And so by pushing this out, what you're able to do is extend time, and that allows you to stage more resources, and it allows the healthcare system to hopefully adjust and be able to deal with the influx of patients. When we look at these cumulatively, and it again is pretty daunting, unmitigated, 4,000 people in the hospital, just being hospitalized, another 1,700 people that would be in the ICU on top of the 4,000, and then another 1,283 on ventilators. So again, that from an unmitigated standpoint, that's an untenable situation. From the mitigated standpoint, it's still difficult, but it's fractional from what we would see in an unmitigated unmitigated approach. 1,683 in the hospital. 1,663 in the hospital. 640 in ICU, and 473 in terms of requirement of ventilatory support over the course of the outbreak. So let's talk about mitigation. Where are we at? I mean, lots of people talk about models and curves and what could happen and what may happen. What both Dr. Park and I are concerned about is what can we absolutely look at in terms of ground truth? What can we look at as factual? So I'm bringing up this chart again, and don't know if it says in my mouse. So I really want to focus on where we're at today, right in this area here. And so the next chart that I bring up is going to basically expand this area so we could see what's going on. Now, again, remember that these curves, they're not facts. These are projections. Projections of the worst case and projections of a projection of what we would hopefully see optimistically, assuming that people are following guidelines. But that's all they are projections. They're not guesses. They're better than guesses, but they are still nonetheless projections. This is a important slide because the blue line here Again, that's a projection. This is the worst case scenario, that blue line. And that blue line was the unmitigated line. Remember, we've zoomed in to see what's going on. And then this area that's shaded, and there's a blue line and there's a shaded area. The shaded area is an area of variance. This is the following week upcoming, and it's a projection or a forecast. And it's basically saying, machine's saying, I'm not quite sure, kind of fall in this range. But the green line, and you can see it here, the green line, that's the mitigated line. That's the other projection. And the other projection is much lower, which is what we do. The red line, that's the money line. That's the line of hospitalizations. That's real data coming in. And if you look at this line, you can see that it is above, initially, both the unmitigated line and the mitigated line. So this was not good news initially. It meant that if unchecked, this line would exceed the blue line. It wanted to curve up on its own. And you could see that it was actually above all the other lines, and that's the trajectory it wanted to take. So I'm going to try to explain this in the most simplistic terms that I can think of, because I think that there's a lot of misinformation. People talk about the virus and an invisible enemy, it's this and it's that. It's not anything. It's a pathogen. It has no brain. It has no intelligence. It's a germ. It's all up to us. So our behavior, our ability to influence what happens, means that we have to change our habits. And that's a very difficult thing to do. That's when we're trying to make these projections about mitigation. Anybody that's ever tried to stop smoking or stop touching their face or anything knows how difficult it is to change a habit and then the discipline to do it. And so you're asking, millions of people to do that all at once. And what you're basically doing, if you do that, is you're taking away from the pathogen what it needs, which is people. It needs contact. It needs to spread. That's all it does. And so the question is, if people did not have the discipline and continue, then this red line would have gone up, but it didn't. In fact, on the 4th of April, we crossed over the unmitigated line, and we're still above the green line, which meant that those projections that I showed before, which were still a little bit troublesome, but better, we just intersected that line, and that was as of yesterday. And the current projection, if you look, as you can see that the red line continues relatively flat. There's an increase because there's still increases in cases, but what we're seeing is that there's overlapping variance now for the first time between the green line and the red line. So we're expecting this red line to actually track with the green line and hopefully significantly underneath it. I know that will make Mr. Birch happy because that means less requirement for ventilators. But until we see that factually, this part is a forecast, and until we see that represented by facts on the ground, actual hospitalizations, I would be remiss if I were to make a suggestion that we would need less than what we had originally projected in the mitigated curve. So again, it's all about ground truth. And so what I've done here is I've taken away the blue line. We don't need the blue line anymore because, well, at least the unmitigated blue line, because we're not going to get there. We've beaten the worst case scenario. The question is, can we continue to push down? So I've replaced the blue line with another line, and these are now confirmed cases. These are the confirmed cases in the county. And you can see that this line is steadily creeping up. And in fact, there's this very sharp turn here in the last few days. And like Dr. Park mentioned, this is represented by the additional testing with Verily and the drive-through testing. As you test more. The more people that you test, the more this line is going to go up. There are lots of people that have this disease within the community, and we just haven't been able to test and establish that. So it's not, you can't go by the cases that are confirmed. You really have to go by the hospitalizations, because the hospitalizations are something that are quantifiable and truly observable across the population. These are people that are becoming sick, symptomatic, and going to the hospital, and then they're tested and confirmed. And what we can see, and also in terms of deaths, so we could see that they're all pretty close together and relatively flat. Now, there's a relationship between confirmed cases and hospitalizations, so you definitely want to continue to watch it and quantify it. So, in looking at our line, let's look at the story that the data is telling. Why did that line stay flat? Why did it just bend up the way that it looked like it wanted to? It definitely had the trajectory initially to do so. You can look at this and see that the first case occurs here at point number 1, and that's the initial hospitalization. And then the blue bars here indicate cases. So the second area here, there was no mitigation in effect. Right, cases were starting to run rampant, and you could see we get our first large blue bar here in terms of cases, and we were seeing that cases went from 1.5 on average to 2.8. So there's an 86% rate of growth. So we were off to a pretty rough start. And then the first stay-at-home order was issued. So when you have an order because of the symptomology of the disease and the time from onset, you're usually looking 2 weeks in the past from the time that you do something to the time that you actually are able to measure the effect. But in any event, the first stay-at-home order was issued, and there was a reduction from 86% to 54% in terms of case doubling. Or when Dr. Park revised the order to become even more strict, that went from 54% to negative 16%. So what you saw was a very, very sharp decline. And with the current mitigation in effect, you can see that that the reduction has been a 44% reduction overall. So we had estimated initially that mitigation would be effective around 40%, and what we're seeing is a 44% reduction, which means that mitigation curve that we were looking at, we're probably going to stay even underneath that. But I don't like to use the words probably as a data scientist. I like to use the words more along the lines of, we're certain, or we see, or evidence suggests. So what can we do in an ongoing fashion? We can see now that mitigation is working. We still have to be very careful, because all it takes is a small outbreak somewhere, or someone coming in that is less committed or hasn't followed or exercised the appropriate discipline, and then we have a problem. And it's difficult for a county of this size and also of this geography kind of spread out. So, Dr. Park and I have been discussing this, and the original work that I was doing prior to COVID-19 was about population health and understanding populations and different disease states. And I was actually working with a hospital here in San Joaquin County, which is, again, how I got to know Dr. Park. And so we actually have something that I'm going to demonstrate. It's very, very unique. But essentially what we're able to do is we've looked at all of the factors that constitute risk for individuals with respect to COVID-19 and outcome. So comorbidity, age, gender, all of the things that might influence their outcome. And we've actually calculated a score, a COVID-19 risk score for every single person, pretty much, well, about 98% of the county. And so we can now plot where the risk is in the community, and we can now target based on that risk. So when we're talking about things that we can do, it might very well be that if you're talking about a leader within the community, being able to talk to people, knowing where the risk is. There's been a lot of talk about, well, to what degree is COVID in a given community affecting a particular segment of the community, the African American population, for instance, or the Latino population, for instance. We can instantly see that. We can look at this data now with this system, first of its kind in the nation, which will be trialed here, to actually identify individual groups and to determine what the impact is, and then the best way to figure out how to mitigate that and mediate that. So I will start that system now. If I can get out of here and. There we go. So this is the live system. It does not, for this monitor, I'll try to do it here. There we go. It's a little squished. So this is the county, and this is the heat map. So essentially, the heat map shows concentration or density. And this is the county. Right now, we're looking at pretty much everybody within the county. We can zoom in, and as we zoom in, we can see individual areas. Down here, we see the individual cities that are represented in the county, and we can see demographic data as well. Income level. So when we talk about disparity and how would you use this, for instance? Well, if you're looking to figure out where you want the best place to put a mobile testing site, you would probably want to go where the risk is the greatest, because these are the people that, when we identify them, are going to be most at risk. So this is everybody. So let's actually change this to be reflective of those people that are at greater risk. In order to do that, I'm going to have to expand this because I can't get to it any other way. No. So the COVID-19, oh, I'm sorry. And then down here, this is the age distribution. So we could see for the county what the average age is. But let's go ahead and move the COVID score. And right now it's from 1 to 60. And so I'm saying from 40 to the score of 40 or higher. So when I do that, you can see that the map looks different. These are the hottest areas. So these are clusters of people that, if they were to contract the disease, have a high risk of a bad outcome. This is before they get it. So this is an area that we would probably want to test. We could see that the ratio of women to men is higher. And we could see that the ratio for the Hispanic or Latino community is also pretty high, and that African Americans are overrepresented. We can see what the age distribution is down here. And then I can also say that I'm interested in finding people that only speak Spanish, for instance. I'm going to change the language to just those people that are primary Spanish speakers. So now I see it looks different again. and I could see that 84% of those people are in Stockton. I could see that 98% of them are Hispanic. I could see the dwelling type, but the point is that using this type of technology, we can actually become proactive. Everything to this point has been reactive. And so, waiting to see what happens and then trying to react to it. We're going to get to a point where we get to the curve and we're going to come down the other side, and it's not going to be a sharp descent. It's going to be a long tail. And what we have to do, because there's one thing that COVID is, that social distancing has been very good at. It's been very good at impacting the disease state, and it's been very, very good at disrupting the economic vitality of the county and really of the country. So one of the things that we would want to look at, obviously, is how can we figure out particular areas where the risk might be greater because the risk to the community is more significant because they have greater risk of a bad outcome, for instance. In another area, it might not be so bad at all. And then on top of this, Dr. Park's team would be able to plot those people that have recovered and those people that have tested positive. So we not only know the risk, but we know who's tested and who's not tested in a particular area. So it will allow the ability to not guess. That pretty much concludes my presentation. I'm available for any questions that the board might have.
Supervisors, questions? That was an amazing presentation. I'm just going to go on record as saying that was fascinating, and it was really informative, and I really appreciate the fact that you've been working with Dr. Park, and this is what's been informing a lot of her decisions. It's really great to see this now, this kind of, look behind the scenes for us. Supervisor Elliott, you had a comment you wanted to make?
Yes, thank you. And yes, I am glad to see that we are including now what actually happened in our graphs, because that's important. Everything else is, as you said, is just a projection,
right?
An opinion. So now this COVID score, I'm still not quite sure I understand how you came up with a COVID score.
Right. So looking at COVID-19, there are a number of factors. And so when you are trying to follow it out, again, I won't get into the dirty business of the sausage making here. No offense to sausage makers anywhere out there. But essentially what we're looking at is how old, we know that this virus disproportionately affects people that are older. So we weight the score for age. If you're older, you're going to be weighted towards a particular outcome. We also look at your dwelling. So how many people live in that household? If it's a multifamily household, or in this case, or based on the number of people, that affects the score. If you are disabled, that affects the score. And I'm just going through a couple of the variables. There are over 39 independent variables that constitute that score. The type of work you do. If you're a gig worker, for instance, as opposed to someone that works at home, that affects your score. Your income, your distance from healthcare. Are you in a healthcare desert, if you will? That affects your score. So all these calculations are conducted to compute an individual score for a given individual, and so that's what we're using for the score. And we preliminarily can see that it appears to be pretty closely correlated, because when we were looking at high risk, Dr. Park has obviously the data on individual people that have actually tested. So we looked at a particular region, and I didn't display it, but we also have broken this down by zip code. So we were able to see that there was a concentration of cases in a particular zip code that perfectly corresponded to the scores that we had issued for or prepared for those people that lived in the zip code. So I was able to tell her, you ought to see the preponderance of bad outcome cases in this particular zip code, and sure enough, they matched up perfectly. So we're very, very encouraged by this. And I believe that you'll very quickly see other counties using this system that's being piloted right here.
So then how do we translate these COVID scores into actions? How do we interpret what that means? So if you see a concentration of the outbreak, I guess, a concentration of positive cases in a certain area, and the COVID score correlates to that, then how do we make that an actionable item? How do we know what caused that increase in the number of cases there? Was it just disregard for social distancing, or what?
Well, I think that it will depend. First of all, you'll understand the composition, right? So you'll be able to look at that and say, well, it's this particular age group. What are the common factors that we're seeing within that particular cluster? Is it that English is a second language, and so we need to have targeted language resources in that area to reinforce social distancing and all the social mitigation things that we're attempting to do. It might very well be that it's an older population. It's difficult to say, because until you know the composition, then you would be able to figure out how you want to target and how you want to intervene, what you would want that intervention strategy to be. But the very first thing is to identify the problem. Here's a cluster. What does it look like? How can we best impact it? Those are the types of things that one of the things that this score could potentially do. I definitely don't want to wade into the golf course controversy, but that's another aspect in terms of looking at where there's risk, where the risk is the greatest, and proximity to, if you're going to, for instance, reestablish operations or reestablish restarting aspects of the economy, certain businesses in a particular area, and understanding that, and because we also know what relative occupations are. So where's the real risk? That's just not something that we've been able to quantify just now. I mean, this has taken some time because we have to understand how the disease was affecting people within a given community. So again, our mortality rate is higher than some other communities, but understanding how the diseases manifest, translate that into a score that fits this particular community, and then figuring out where there are pockets of risk that are greater, because it's not universal, right? It's different, and it's different by individual. We can get that granular, but looking at it in proximity, we actually get a better sense.
Right. Well, I certainly commend your efforts to try to get down into some of the finer details of where the concentrations come from, and where the most cases are. I think we still have a major hurdle in trying to identify what actually caused there to be more cases there. So we're talking about, okay, maybe people who have English as a second language. Okay, so the cause, I suppose, if you start there, the cause of somebody getting the disease was being close to someone who had it, or something like that.
Right.
And why was there more people getting close to people who had it in this area? Was it because they they just chose not to social distance? Or was it because they knew they should, but they didn't? Or because they didn't understand that they should? I mean, those are all the other aspects of how do we get to the solution.
Yeah, I think I better understand your question. So when we're looking at a cluster, like I said, we have a bunch of variables. We can find out which of those variables are most correlated to that particular cluster, and say, okay, well, we could see that it's the size of the family, and this actually then allows Dr. Park and her investigators to isolate and to find out exactly why, but at least they have a place to start. Because otherwise, the only other thing that we see is hospitalizations, right? We're looking at people that are at risk before they present at the hospital. If we wait for them to get to the hospital, then a percentage of those people, depending on who it is, let's say it's an older group, half of those people will wind up in the ICU. Half of those people will wind up on a ventilator. Half of those people will wind up dead. So we definitely want to get in front of this as opposed to behind it. But if you isolate the cluster, and we know there are 8 key variables that are tying the people within this cluster together, that gives Dr. Park's investigators a starting point to isolate and to really figure out what type of intervention strategy is needed. And also, there's the other aspect of this, of being proactive. If there is a second wave, we'll be ready. I don't want to jump in front of Dr. Park and say necessarily that she'll be ready. But the point is that we'll be better prepared than most, because we'll have a census of people that have been tested, people that have recovered, that therefore have conferred or herd immunity, if you will, and people that are outside of that census. And so we'll know proactively beforehand what our risk is before a second wave comes, and we'll be better prepared, because I think that everyone can agree we cannot go through this again.
Right. Well, I commend you for interjecting the reality into the data that you're collecting and displaying, because I think that, and I'm assuming you're going to keep doing that as time goes on, so that we can better refine the way these models look and the way the actuals.
I don't think I have a choice. I mean, Dr. Park, we talk several times a day. I would offer morning, noon, and night, I'm pretty sure that given Dr. Park and her tenacity and the fact that she doesn't seem to sleep, I think it'll probably be around for a little while, whether I like it or not.
Well, great, because I think that's the only way we can actually trust and really get meaning out of the effort to put all this data together, is if we continually interject what actually happened into the model, so that the model accurately reflects reality.
You're absolutely correct. A model is useless unless it's being retrained based on reality and actual data. And again, thanks to Dr. Park and her team, and especially her epidemiologists, who have taken the extra time to make sure that we're getting the data to inform the model, and therefore inform her decision making, and hopefully inform your policy making.
All right. Thank you.
Thank you.
Thank you. Supervisor Wynn?
Thank you, Madam Chair. All I can say is an outstanding presentation. And I want to commend not only Dr. Park and certainly her efforts, but certainly Director Cunningham, Ms. Lemus, in regards to their departments. And we've come a long ways in regards to informing the public of what's going on. This is an integral part, in listening to the public comments, and I know we've all received letters and a whole bunch of other things from constituents who are concerned about, what the future holds and when we're going to reopen, et cetera. But I was impressed by certainly the various, categories that you can identify in regards to trying to focus on the most severe areas, or maybe that need the most attention. I just happened to look, and this is kind of interesting. This is the New York City health department talking about their deaths. And I'll just two figures that kind of resonated. They've had, in the city of New York, they've had 4,735 deaths. And of those deaths, only 128 were for individuals who didn't have a underlying comorbidity condition, which certainly indicates that, that's an area when you talk about deaths, and I know we're talking about cases also, which are important, but it just shows the overwhelming potential risk for those who have those conditions, and there's lung disease and cancer, and there's a whole list of them. And I guess that's an area, and we talked earlier with IHSS, some of the reports that came out, for example, the state of Washington, in regards to the nursing home. A lot of nursing homes were not equipped with PPE equipment, and nor the training at times. And so in some cases that exacerbated the problem because of a lack of preparedness, as you've talked about. So I think those are things that we're learning along the way. But, when you talk about, the hot spots, the areas, et cetera, as Supervisor Elliott touched upon, the question arises is we kind of make an assumption that maybe it was from that location where they live or reside, when in fact they may have obtained it somewhere else. And I guess one of the questions is, of those cases, and I want to focus on San Joaquin County. I don't care what happens in New York and LA and all those other places because we are unique. In fact, one of the statistics that stands out is, as far as the deaths, we're way above our other valley counties down to Kern County. And the question is why? And I'm not pointing fingers, it's just a question. So the question is, how many of the cases that we've had in this county were related to individuals who are in essential businesses? In other words, they're going to work, whether it be a grocery clerk or a healthcare provider, et cetera. So that identifies, the potential of those businesses that continue, like the county government, that continue to operate, as far as what risk are they experiencing in their day-to-day activities. And the other part is in regards to those with underlying conditions. I'm sure, based upon our nursing homes, based upon our areas, we have a gathering of seniors, whether it be senior housing, et cetera. But it seems like we could maybe increase our efforts to really inform those individuals. And I guess one of the concerns I've had, and just again, this is just an observation because I know this is brand new, we're kind of feeling our way, but when we started down this path, there was a tremendous concern about the 200,000 deaths that may occur, and then it was 100,000 in mitigation and all these other things, and the lack of hospital beds and ICU beds and ventilators and all those other things that we scrambled to collect. As more information comes in, it's going down, and as Mr. Birch talks about, we are prepared in this county based upon an increase, reaching our apex, et cetera. And that's comforting to know for our residents that if something happens, they will be cared for and not have to be unattended because we don't have either the equipment or the staff to treat them. However, over a period of time, from the initial concern in regards to flattening the curve, which we've done a good job at, certainly nationwide and in most cases, and certainly San Joaquin County. But now, we've kind of moved to this zero, of eradicating coronavirus, which is obviously important. But at the same time, and some of the comments from the public is, we need to do this, we need to do that. It isn't just one category, one area we as a board or the county have to focus on. Because now what's arising is real angst in regards to the public and workers, irrespective of the trillions of dollars the federal government wants to dole out. People want to get back to work. They want a paycheck. They want to provide for their families, et cetera. And so when we talk about, as we continue to move forward and eventually come out of this pandemic, I think there's a real challenge to to be sensitive to the fact that I don't think we'll reach a point, because it's like H1N1, it's like Ebola, it's like a whole bunch of SARS, all the things we've experienced. But we don't necessarily, our flu in general, we don't necessarily eradicate it. We experience it every year. And hopefully with vaccines and other treatments that we're generating, certainly through the testing, we can, I don't want to say control, but at least we can handle any future outbreaks. For example, a recurrence that everybody's afraid of, that some of these countries that are starting to open up will have another, outbreak. So all I'm saying is that I think we have to do a multitask, certainly from the healthcare and protecting the public and their safety. But the other side of it we have to consider is that we can't expect to necessarily be almost to a zero risk game before we start opening up our businesses to return. Because I'm sure Mr. Dieterich, in regards to behavioral health, and you look at this news stories in regards to, and I don't want to overplay this, but there are suicides, there are drug overdoses, there are a whole host of things that are happening. And so we have to take into account the global picture and try to address it as best we can and not adversely affect one portion of it. So I really appreciate your insights and certainly your models, because I think a couple things need to happen, and we're already starting, is you've talked about, we need more testing. We need to test and find out what's going on in this county. I mean, and we talk about, percentages. Well, a lot of the percentages, the variations are because some jurisdictions, for example, New York, have had a lot more testing than we've had. And when we reach that point of I don't want to say saturation, but more complete testing to really identify certain areas, certain individuals, certain, whether it be the gender, the race, whatever. I say certainly this board and our county departments will have a better sense of how we can move forward and not be so restrictive, because we have to move based upon factual information. Projections are great, right, but we have to make sure that when we make those decisions, they don't have an unintended consequence. And I think that's the concern that I know we all have, to make sure that we make the best decisions with the best information that's available at the time. And what I've heard here today, I think gives me a greater sense of understanding the true picture and the best way we can move forward with some factual information based upon what I believe, or trusting some realistic projections to make these decisions for the future. So, Dr. Parks, certainly, I think it's a great asset for us to have this for future decision making. So thank both of you for that.
Thank you.
Welcome. And I want to say, in regards to your question as far as do we know what percentage of our positives were essential workers, it's a very difficult question to answer. We're constantly trying to do our contact investigations to track back where somebody might have been exposed to COVID, and sometimes it's just very hard to pinpoint. We have maybe a healthcare worker who's been in the healthcare setting but has also recently traveled outside the county or even outside the state or been on a cruise. So it's really hard to say, did you get it in the healthcare setting? Did you get it in the cruise? Did you get it when you were visiting another state? And so some of those numbers are very difficult to come up with. In regards to your comment about multitasking, that's exactly where the state is headed. Obviously, we're not going to be able to get to zero risk before we start reopening businesses and start letting people out of their homes. That's just not the reality. We have to get to a certain point where we believe the risk is low enough that we can start to reopen the county. And I want to let you know that the state health officer did just this morning have a call with us where she said that there will be 6 indicators that the state will be looking at to get a better understanding of how to move forward. And she made it very clear that these 6 indicators are just indicators. They're not triggers. So there's no sense of the word trigger. There's no event or one thing that will trigger us to reopen. There's 6 things they're looking at statewide. And number one is the ability to test. And this is what you alluded to, Supervisor Wynn, is that we need to test widely. And that's in a lot of the models that we're seeing put out by these national experts, is that we need to test, we need to do contact tracings, and then isolate those who are positive and support those who have been exposed. And looking for support from the state level, because obviously with the staffing that I have, we're not going to be able to massively expand our contact tracing. So I'm hoping that the governor and our state health officer gives us some guidance on that. There's a lot of counties looking into various ways to increase their contact tracing capacity by bringing in people who are furloughed or currently not working to start working at public health and do some of the work of calling people and isolating them. So that'll be interesting to see how we work that out. The second indicator was the ability to prevent infection in people who are at risk for more severe infection. So these are the older people and the medically vulnerable. And people with disabilities and perhaps people who are incarcerated. So this second indicator is exactly the one that we can go after now proactively, as Mr. Davis said. If we use the mapping that he has and the locations that he can give us, we might be able to then say, I know where the people who are at most risk are, and maybe I can get some assistance in actually contacting them. Maybe I can send them a letter in English and Spanish if I know that they're Spanish speaking in that area, and kind of deluge that area with more messaging. And so I've been in talks with Dr. Danvantari, the Chief Medical Officer of the Health Plan of San Joaquin. She has much of her staff calling their clients and giving them health messaging, stay-at-home messaging, and she is interested in expanding that effort to all people, not just people who are Health Plan of San Joaquin clients. So I'm looking to work with her to help get Chuck's information and make it active and useful to us. The third indicator was the ability for healthcare facilities to handle surges, such as bed capacity, staffing, and supplies. The fourth indicator that the state will be looking at is the ability to develop therapeutics and to meet the demand for potential therapeutics. And of course, that's at a level that's out of my hands, and it's more in the scientific world and the medical world and research world. So that indicator I can't really affect. The fifth indicator was the ability for businesses, schools, and childcare facilities to support physical distancing practices. And very happy that our order does make mention of social distancing protocols as a new requirement. So we'll be looking to enforce that and to make sure that those businesses, schools, and childcare facilities understand that that's an important indicator. And the sixth indicator is the ability to determine when to reinstitute social distancing measures. In other words, if our curve starts to go the wrong way as a state, when do we then say that everyone needs to shelter at home again? So to reintroduce restrictions, and that's a very real possibility, and something that people need to understand is that as we start to let maybe children out before the elderly and make and more essential businesses, or businesses that we consider to have some important function, as we slowly determine who can reopen, we need to watch our case counts and our numbers and see if we then need to hold back and reintroduce restrictions. So those are the indicators, and just wanted to go over those with you so I could tell you that out of the indicators that we're given, the one that we can really affect through Chuck's data is the second one on isolating and making sure that people at risk continue to stay home.
Supervisor Patty?
Thank you, Madam Chair. Well, it's great presentation. Thank you. Very informative and even somewhat interactive, where you can really model in on where some risks are. Question for you. When you're doing your modeling, as Supervisor Wynn had pointed out, a lot of individuals have pre-existing health issues, and there's a myriad of factors. I mean, there's age, there's lung issues, compromised immune system, heart disease, diabetes, liver disease, chronic kidney disease, obesity, neurological disorders, asthma, HIV, epilepsy. I mean, there's a whole myriad. So when you're modeling the risks and the potentials for hospitalization and such, is that factored in, or are you modeling by population and exposure risks?
Right. So great question. This is not just strictly based on population. There's a back-end database that has over 400 variables on each individual. And so some of those include comorbidities. And so we're actually able to weight those. So for instance, if the person has hypertension, and there's also an inferred aspect of that. So there are people, for instance, some of this relies on something called IRI data, which is what a typical household buys in terms of their groceries. There's actually a separate calculation that looks at all the food that goes into a particular household, and then makes an estimation about the quality of that food. For instance, take myself, for example, African American. System knows that I'm African American, knows my age. If I have a high sodium diet, not very active, or whatever the case might be, the system actually takes that into consideration and then makes a determination. So there are some hard variables that are in the system, and there are some inferred as well.
Interesting. So I guess my interest and discussion would focus on and pick up to the point that Supervisor Wynn was talking about is the economic impacts that this has. And I don't know if, sure we can't pull back up your graph, or maybe we could, but I'd like to ask Dr. Park, there's obviously this peak that's going to happen. I believe it was sometime of later May was the modeling that you were showing. So then at what point do you think you're interested, because it seems though you've held steadfast on some of the decisions you've made, and when do you think you're going to soften up on some of those positions as it relates to jobs and economic value and sustainability? And the reason why I ask that is this last week, yesterday, you, myself, and Supervisor Elliott participated in a conversation with doctors the hospital directors and the different representatives from the chambers of commerce in our adjoining cities. And they all shared the concerns of what would happen if it escalates back up and being prepared for it. Several days prior to that, I had a discussion with all of the chambers of commerce and a myriad of people, and then the consensus was when we get to that point of about 3 months out of businesses being shut down, we're getting to that point of no return, where businesses will be permanently shut and unable to reopen. They're going to be too far down in the hole. Speaking with, and as we've talked about, we heard a lot of public comment, speaking of golf courses and those jobs, we're looking at approximately 250 jobs due to the actions taken in San Joaquin County. We have 250 jobs are lost right now. And these are people, of course, that are trying to pay rent or mortgage and take care of their families. One country club assessed that they're losing, one operation losing about $125,000 a month. And by month 3, and we're into month 2 now, they're done. They're closing up. They won't be able to come back from that. So, while your position seems to be steadfast in how you feel about golf and hasn't softened, even though some of the supervisors have asked you and directed, to consider, and I at some point provided, 2 weeks ago, I provided 49 actions and measures that could be taken for golf courses to put in safeguards and buffers and barriers and eliminate a risk of infection and the spread. Did you have a chance to see those 49 measures?
I have, yes.
You have. And did you take them into consideration in your decision to keep golf courses shut?
Yes, Supervisor Patty. So back to the beginning of your questioning about the timing, I'm very heartened to see that our timeline is really much in line with what the governor is looking at with his models. Initially they were talking about end of April as the peak for California, and now his timeline really seems to match ours, and so I'm trusting the data and I'm trusting the modeling that the governor's looking at, and I'm very much looking forward to what announcement he comes out with today, because I do feel that we're in line with California as a whole. So when he starts to lift restrictions, I will feel comfortable lifting restrictions simultaneously as the state does. So I'm really going to be taking my guidance from the state when it comes back to reopening the county. In regards to golf, the new order does allow for golf courses to operate with the minimum basic operations. So my understanding of that would be a minimum basic operation could include mowing the lawn and keeping the facilities manicured in order for losses financially to not be as great. the state has directed me, 3 different people from the state have directed me to stay the course, as golfing is non-essential according to the lawyers coming out of the Essential Inquiries Department of the governor's office. But I have seen those letters, and I've seen several country clubs give me nice lists of the ways that they would enact social distancing. So as we start to come out of restrictions, I'm actually considering looking at some of those, and I am taking them to heart and thinking about ways to maybe have perhaps a private country club that has given me all of their social distancing protocols and saying that they might be in a group that would be first to reopen. So people who can demonstrate to me, businesses that can demonstrate that they are able to enact social distancing protocols successfully might actually move up to the front of the line as far as reopening. So those are the things that I'm looking at, and I know that other counties are looking at that as well, and the governor as well. So there's many, many dimensions that we need to look at, but certainly we're looking for people who can demonstrate that they can actually continue to enact social distancing protocols as best they can as we start to reopen.
Fantastic. And so sounds like you're willing to give businesses a chance to demonstrate that they would have some social distancing and parameters of safety and...
Certainly, but my timeline will be based on the governor's timeline. So I will be following a lot of what comes out of the state, and we're getting a lot of direction from the health officer of the state.
Now, but you do have flexibility, so much so that I've spoke with Madeira recently, had reversed their no golf position, and I spoke with Dr. Simon Paul just last week and asked him what was the impetus for his change. And he said, well, people were out there using the courses and it's unregulated. So it was better off to use and have a facility monitoring and managing what was happening on their location versus it happening without their oversight. So then we also look at Sacramento as we talk about waiting for the governor. In Sacramento, golf courses are operating. And Peter Bielenson, who's a non-golfer, toured, there's an article in the Sacramento Bee, but he toured a pair of properties before making his decision to allow golf courses in Sacramento County to remain open with heightened precautions. And even though he saw a significant number of cars in parking lots, he went to the courses and saw social distancing. Even on the putting greens or on the driving range, there was ample space and precautions being taken. So there is enough flexibility in the governor's rulings here on page number 4 of the recent report. It says, to engage in outdoor activity, provided the individual comply with social distancing requirements as defined in this section, such as by way of example and without limitation, walking, hiking, biking, running, and equestrian activities. So it does allow for outdoor activities. Speaking with Senator Galgiani, she also spoke with people in Sacramento that said there is parameters and willingness for counties to make their own decisions. So this really does rest on your shoulders, where you've got the public asking, you've got supervisor asking. We didn't hire you. You're an interim director, and you're doing a wonderful job. You're working very hard. You're dedicated. I don't know of anybody that would do a better job in the application of all that you're doing and considering the factors and trying to mitigate risks and the public safety on a greater scheme and big picture. But I do think you'd be well advised from my perspective, and speaking as a board member, to start to listen to the public and take into consideration and give them that opportunity to prove they can operate with all these parameters and safe outdoor activity, but most importantly, those jobs and the sustainability of some of these businesses. And lastly, I'd share with you, as you've expressed the willingness, and we all will pay attention to what the governor says, but we can't afford to go, if it's subject to interpretation and our own regulations that we want to apply locally, we can't afford to go out 5, 6, 8 months or 8 weeks from now. There's going to be detriment and damage well beyond recovery. So if we're looking at a matter of days to modify, but I would suggest in our very own department, Mr. Steve Landsberger had put together a little white sheet here, I guess we can call it, of about looks like 8 or 10 different measures of what we could do for allow businesses to operate and safety parameters that could be put in place, and maybe I'll review with him some of this as it relates to some of this discussion and maybe send it over to you to consider what we can do to help businesses operate and survive. And it's jobs. It comes all down to jobs. So, I'm glad to know that you're interested in looking at the possibilities of what we could do, perhaps sooner than later, but I would stress the point that we really need it sooner than later. I've received letters and calls from people that work at some of these golf recreation facilities, and they're begging me to stress to you how important it is. They work 2 jobs. They can't pay for their child care anymore. They are suffering and dealing with hardships, rent, and all the things. And there's government things. You can't throw people out of their house, and you can't. What about the back rent? What about mortgage payments that are going to be due once the restrictions are lifted, and you're going to owe that money? They're going to get deeper and deeper in a hole, and the government's not going to fix it. It's resting on our shoulders and a tremendous burden on your shoulders. So I'm just imploring you to please pay attention to those of us that are talking about this is our economy. This is more than just medical. And if we can do it with all the concerns you have, rightfully and justly so, with all the concerns you have for the medical and public safety and to the greatest degree of concern, if there are businesses that can operate and we can allow economic activity and people to be self-sustaining, then I think we need to take that as a massive priority much sooner than later. So I'll finish with that. And I appreciate your hard work and dedication and your willingness to be open to this possibility. And let's work together and do it sooner than later. Thank you.
Thank you. Supervisor Villaputa?
Yes, thank you, Chair Miller. First of all, Mr. Park, I want to thank you, too, for the wonderful job you're doing. I know it's a huge responsibility. I currently sit on the Parks and Recreation Board, and I was speaking to some of my other board members. And as far as like Swenson Golf Course, they're in dire need of opening. It costs around $60,000 a month to operate. If they don't, like Supervisor Patty said, if they don't open their doors soon, they will close, and they can't continue to keep the doors closed and operate this way. So I agree with most of the public comments. It's like going to the store. It's like going to Costco. People are waiting in line. There's no interaction. People like to golf, and people are walking the course now. They don't have a club in their hand. What's the difference? I would recommend we open the golf courses also. We're getting so much. People need some time to unwind. I think golf is the perfect example, and I think they're going to show that they can do that without being within 6 feet. So I'm hoping we can make something happen there. Thank you.
Thank you. Supervisor Elliott, you have another comment?
Yes, thank you. Yes, the first time I spoke, I was really just wanting to better understand the presentation, and thank you again for that presentation. But now I'd just like to add a few general comments here. And Dr. Park, I was very glad to see that you participated in that teleconference yesterday with the various chambers of commerce, leaders of the hospitals, et cetera. To hear the concerns and the approaches that people would like to take. But I think it's also very important that we continue to look at our order, and I'm heartened by the improvements that were made, the changes that were made in this revised health order that's going to go into effect later today, where we did make some allowances for common sense businesses to be able to continue to operate in a common sense fashion is what I meant, where they are taking to heart some of the social distancing, the benefits of that and the requirements to do that. And I'm glad to hear that you want to take a look at options for businesses, even non-essential businesses, options that they can enact to demonstrate that they can open their businesses and do it in a responsible fashion. Because what we need to do is get people back to work, but do it in a way that protects the public health. So I was glad to see some clarification here on real estate operations. I think it's important that we allow that type of operation to continue, and I think that the provisions in the new order will take a lot of that into consideration. And also some of these private exercise facilities. We talked a lot about golf, but there are also private exercise clubs. And I emphasize some of the private clubs especially because those are based on memberships, which makes it much easier for the management to be able to enforce these social distancing requirements that they say they will enact in order to allow themselves to be open. Because since they are based on membership, then they can require their members to do these things that they say they are going to do to open in a responsible fashion. So I think we need to look at all of those things and grant to the maximum extent possible our businesses to be able to open on a responsible basis. And by that I mean the non-essential businesses as well. We already got the essential businesses that are doing that. So I just urge you to continue looking at this, to look at the proposals that are submitted by different business sectors to say, here's what we're going to do to ensure the public health and the health of our employees and allow our businesses to open in a responsible fashion. Because that's part of public health as well, to have people be able to engage in some of the activities that they are used to, the activities that make it appear they are living a more normal life again, and the activities that allow them to support their families. And all of that contributes to people's mental health, physical health, and economic health as well. And so those are all the things we need to consider. And I just urge you to consider those things as we continue to look for ways to make our public health order better and more able to accommodate the needs of our citizens. Thank you.
Supervisor Wynn, do you have a final comment?
A brief one, thank you. Having belonged to gyms and never belonged to a golf course, I think we're talking apples and oranges. But having said that, in your new order, there is an application that is enclosed in regards to businesses that talk about, adhering to certain guidelines, social distancing, et cetera. And I guess the question is, would it be possible, and I understand the evolution with the governor's orders, et cetera, but would it be, or maybe feasible for businesses, as we've talked about here today, to submit those applications, basically outlining how they would, abide by the regulations and explain as portions in there how they would do this? If for no other reason, as we get more information from the state, you would have the ability to already have, or whoever, have a chance to preview those, and then when the information comes down that kind of fits in that particular box, we could move forward as opposed to starting from scratch and saying you can do this, and now they have to. Because I think there's a, as has been said by the other supervisors, I think there's a anxiety from businesses wanting to somehow get the ball moving, and I think that application would be a good start for them to express as we do, and I think they can probably do a better job than we can as to how they would be able to address your concerns and provide, or at least maybe for no other reason, provide some discussion between you or your office and them as to maybe there's things that you would see in those applications that maybe you could add to, and then when changes come down, we can turn the key almost instantaneously, knowing that that's already been reviewed, and all we need is the additional information from the state. So just a thought. Thank you.
Thank you. That's a very interesting question, because I am getting the letters for sure, but no applications per se, and maybe it's something I could explore with County Council as far as how to proceed with that possible idea. And I do appreciate all of the comments from Supervisor Patty and Supervisor Villapudua, Supervisor Elliott, and I do take them to heart. This is probably not the last rendition of our stay-at-home order. As you can see, we've pretty much been updating it almost on a weekly basis. So, everything that you're saying, all of your comments, I do take them and think about them, and I am reading everybody's letters. I don't have the time to respond to them all, but I am receiving many, many letters on various issues, and I've read them all, so I understand the concerns that are out there, and I do understand the need to keep people physically healthy and mentally healthy as well, and to get business back in order. So it's something that is going to be the next 1 to 2 weeks of my life, I think, is really delving into the planning of this, of coming out of this stay-at-home order, and it's going to take a lot of thought, and I appreciate the comments.
Thank you. Dr. Park, I want to thank you as well. It's very heartening for all of us to see how open you are. I know that these are very difficult decisions you've been making. You have been working around the clock. All of us appreciate your dedication to this. I think when you see how effective the mitigations have been in this county, that we have dropped that curve 44%, that's a huge number, especially when you consider we were on track to exceed the no mitigation curve, and now we are 44% below. That is really a testament not only to your work, but also the efforts that all the residents of San Joaquin County have made to take it seriously and really work hard, despite a lot of challenges, to not overwhelm our frontline healthcare workers or our first responders or any of our capabilities in this county. And so I agree with you. I think the next couple weeks are going to be about how do we now safely begin to relax some of these mitigation efforts. I know you have been, but I'm very pleased to hear you tell the public that you are reading all of the messages and all of the comments. Many of them have been very thoughtful and very well researched. They've included materials from a lot of other parts of the state. I know that I have been reading all those along with my fellow board members. And so it's also extremely gratifying to see how much of the decisions to date have been based on this science and this data and this very accurate modeling. And it gives me a lot of confidence going forward that if you're continuing to use this sort of modeling, and we are on track with the state, that we are going to have a lot of good indications for how we can start to relax this and everybody start to get at least a portion of our lives back. So thank you. Is there anything else you want to update us on at this time?
No, that was it. Thank you so much.
I had a follow-up.
Okay.
Yes.
We have other people to present.
Yeah.
Go ahead.
Just real quick, a quick follow-up for you. I got a phone call yesterday from a friend of mine who's traveling international, and he said over in Hong Kong, and I looked up some stats, 7.5 million people, and it looks like they have 1,013 infections and 4 deaths. And he noted that everybody's there was wearing masks. If you're out in public and within proximities, close proximity of people, in general, they're wearing masks. And it was striking. I don't know if you have any different information or if we can start to look at what's working effectively elsewhere with the spreading. There was somebody that may be asymptomatic. Do you have any input on that? As you noted earlier, the CDC has changed at first it was no masks. Now they're talking about how you might want to wear a mask. What could we do in San Joaquin County to expedite the lowering of that curve? And
thank you for that question. So, we cannot advise people to buy surgical masks or N95s, obviously. So people are making their own cloth facial coverings. We're not really calling them masks. We're calling them facial coverings. And this is because of the recommendation coming out of the CDC. What percentage of risk does it really do to reduce and prevent spread of disease is yet unknown, but the feeling is that there could be some potential benefit, and the benefit would really be greater if everybody wore a facial covering, because the the purpose for wearing a mask is so that somebody who is sick would cough or sneeze into the mask and not transmit it to somebody else. And now with all of this evidence that there's asymptomatic spread with people just maybe talking or even breathing hard on somebody able to transmit disease without having any symptoms, the masking guidance covers that possibility of that sort of transmission. So it really protects the person who's not wearing the mask from the person who's wearing it and can spread. But if everyone were to wear something, then you might have some protection. So it's interesting that you asked, because the state of California is actually consider making it a universal order. So we will yet see. And this is part of their whole plan to slowly let businesses reopen and the economy start up again. As you try to reopen everything and try to get people back moving, what do you do to try to still keep the numbers down and keep the case count reasonable? And so it's something that's being considered to make it an actual order. And it's been talked about with the state health officer. And I don't know if or when it's really going to come, but there are a lot of counties who are asking for it and who are behind that. So it may become a reality that instead of just a recommendation, it becomes a state order.
I'm not a doctor, and I appreciate that, but we might want to consider if you're indoors and going to be within 6-foot proximity of somebody that need to wear a mask in San Joaquin County, to see if that even flattens our curve faster. I mean, we may want to try something like that as we're talking about and arguing to the point of relaxing some of the restrictions as it relates to jobs and economic activity. And lastly, to that point, since I did have a couple of conversations with the Chambers of Commerce and some businesses, what I'll do is through John Solis and Steve Landsberger, maybe show you and share with you some of what we found that the businesses are asking for and what they're volunteering and what they could do, so that as we consider parameters of operation, you're already informed by our chambers and the business community what actions they could take and what they would recommend would be safe practices at their operations.
Okay, thank you.
Thank you. Okay, we are going to take a 10-minute break, and then we're going to hear from Dan Birch, our EMS director, and I also have Mr. John Solis, who is going to give us an economic development overview, and then we'll see if there's any other staff after that wants to provide some more input to the board, but we're going to be back in 10 minutes, 10 till. We will be back here.
Thank you, Chair Miller, members of the board. As soon as the clerk sets up the PowerPoint, I just got a few slides for today to give you an update from last week. We'll go over those. Actually, we got some really good news I'd like to share with the board on the readiness of our hospitals and our medical care system. So last week I reported that we had increased our surge capacity at our acute care hospital by 63%. I'm happy to report today that with the work of the hospitals, we're now able to achieve a 99.7% increase in hospital beds. So
Wow.
We've doubled our capacity. We've exceeded even all our original surge planning targets for all the acute care hospitals.
That's amazing. Great job to everybody involved. That's just
the hospitals deserve all the credit. They're the ones that have made it happen. And I think that's an effort that we're not giving up on. We're still working with the hospitals to expand on that. And I can go into that a little further as we go through the slides. We also, last week, started reaching out to the skilled nursing facilities and the long-term care facilities and speaking with them. Just in discussions with the skilled nursing facilities, which are the higher level facilities that can take patients directly discharged from a hospital that still require medical attention. And just in our conversations with them over the course of the week in opening up those contacts, they were able to increase bed capacity without any help from us, just talking to them, by 139 beds, which I think is, there again, I think there's a lot of untapped potential there for our county as we move forward. And then just over the last, on Friday and Monday, just to report out, we processed over 100,000 individual medical resource request items out of our office through the state mutual aid system. Most of that is personal protective equipment. We are also moving now some medical equipment supplies, and this week for the first time we're getting requests for pharmaceuticals from the hospitals and moving those through. First, I'd like to talk about the number of COVID positive patients at our hospitals. So we are collecting on a daily basis information from each of the hospitals on their surge capacity as well as the number of COVID positive patients that are in their hospitals. Currently in our county, there are 25 individuals hospitalized with COVID symptoms as of yesterday's reporting. Of those, there's an additional 15 who are suspected of having COVID. 12 of those patients are in the intensive care unit, and 8 of those patients are currently utilizing a ventilator. On our intensive care unit status, the hospitals have reported we have 99 licensed intensive care unit beds on a normal basis in our county. The current census is 84%. There's 84 patients currently using an intensive care unit bed in this county. What the hospitals are also reporting, though, is that they can expand and almost double the ICU capacity at their hospitals to 90 additional beds. Some of that will be cardiac care beds that will be transitioned to intensive care if necessary. Some of it might be post-anesthesia recovery unit beds that they can move into intensive care. But the hospitals are reporting that they can increase capacity by 84% in intensive care unit beds at the current stage right now, at our current planning stage.
Does that mean they can staff them?
That's the
Heard last week there was a difference in those two numbers.
Absolutely. Staffing is the big concern for all the hospitals. At the current, so each hospital has reported a little differently on their ability to staff. All have plans to maximize their current employees to staff. The state has waived all of the staffing ratios at the various hospitals. Now, so it's a matter of just how safely the hospitals feel that they can provide the services. We know the state has enrolled over 70,000 medical personnel in the health corps, which would be available to the hospitals if necessary. And so that will be dependent upon if those beds become necessary, what are the types of personnel available and how we can best utilize those. There's a lot of discussion about just how to staff those. A lot of the hospitals have reported, though, that they believe that they can staff the beds that they've projected for surge with their own staffing. But part of that will be an estimate on that their staffing is currently healthy and available to come in to provide those services. And then lastly, on just the hospital bed census as a whole, as I reported earlier, there are 952 licensed hospital beds of all categories in our hospitals today, as we're reporting them. The current medical census, or the current census for patients using a medical surgical bed is 311, which means that only about 33% of our current licensed beds are in use right now. The hospitals are essentially as a low a census as you might ever see again in this county for hospital beds. So there's a tremendous amount of current capacity at the hospitals, because we have over 595 licensed beds not in use today. And then as of yesterday's reporting, the hospitals can now say they can surge up to 950, and that includes St. Joseph's, which is the big difference, now reporting that they can surge up to 529 additional beds. So we're working on that. That number represents projection at this point. We have about 225 beds that we can provide to them currently that we still have in reserve to deploy. Now we have to work with them on finding the other beds if necessary on how to staff that. So we have some projections on that, but I feel fairly confident that if we had to, we could go to the 1545, which we now are reporting with the hospitals. And as you said, the big kicker is can we staff them all when the time comes? That covers all my slides for today.
Any questions? Supervisor Patty.
Thank you, Madam Chair. A quick question for you. A lot of the hospitals, when we were having a conversation with them yesterday, they were obviously all the elective surgeries are down, and since our surge capacity requirements aren't at that stage right now, can we start to talk to the hospitals about allowing some of these elective surgeries that need to be done for people that need this type of care?
That actually, I spoke with one of our hospital administrators yesterday specifically about that subject, and as we were talking about because of the economic impact on the healthcare system right now of the cost of readiness versus the current demand. It's not really a county decision on when they open up for elective surgeries. Okay. They're being guided by recommendations from the state and federal healthcare resources, but also their own organizations on when their health systems are going to advise all of their hospitals when they can start determining what's elective and what's not. So there's each hospital today makes a determination on whether or not a certain procedure is required or is elective, and whether or not that procedure, the risk of the procedure outweighs the benefits and on a daily basis. And that's a medical decision that the hospitals are able to create. But there are a lot of reports that are coming out where they have done elective surgeries, even robotically, where there has been reported exposures of the surgical staff due to lasers and smoke inhalation and becoming positive with COVID. So that's the medical community is having to make a decision on the risk benefit of opening back up their hospitals, both for their own staff and for perhaps exposing patients to a higher risk environment. So I hate to say it's a very complicated issue, but we have broached that with our hospitals, and I'm letting them take the lead and letting me know when they believe it is safe to reopen.
Okay, so they have autonomy and their own discretion to do some of this?
Yes, sir.
Okay, thank you.
Okay, thank you so much.
Thank you.
Mr. Diedrich, do you have anything to add in here since we're talking about hospitals and medical capacity?
Because I'm very appreciative of the models we had this morning, and obviously no model's right, but some models provide actionable data, and I think that's what we have. This morning, the state did come out with some county-level modeling, and what Chuck Davis was mentioning was admissions per day, and that's the demand for people coming into the hospital, but that's got to be balanced with the average length of stay. So what we really need to start looking at is hospital census. And the models that came out from the state today for San Joaquin County at a high point at as a mean, 1,723 people in the hospital on the high day for COVID. That's the mean. The median is 876. So a lot of what we're doing to flatten that curve, I think, still needs to continue, because when Dan mentions these beds and the staffing, on a national level, they're talking now that there's a 1 in 4 chance that we will exceed hospital capacity. And there's also dialogue that if we relax too early, that chance doubles. So I think this is quite a balancing act for Dr. Park and our county to continue these mitigation efforts such that we do not overwhelm our hospital capacity. But obviously there is a tremendous economic impact to also consider. So thank you.
Thank you. Okay, we're going to move on now to John Solis. He's going to provide us with an overview of some economic development resources for assistance to our businesses in San Joaquin County. Mr. Solis, thank you for being here today.
Madam Chair, members of the board, thank you for the opportunity to share this information with you. If I could have the presentation. Okay. The State Employment Development Department publishes UI claim data each Thursday for the prior week. And in March the 14th, we had 670 claims. A week later, at March 21st, we had 2,551. And on the last week of March, ending March 28th, we had 18,628 claims. Just to give you an idea that, the claims processed as of the week ending April the 4th is 925,450. Now, I wanted to give you a comparison on how this pandemic crisis had impacted our economy as it relates to the unemployment rates, but the state only has the February data, and it wasn't it didn't present a realistic picture. When you compare it between January and the year before, the critical month is the month of March. And that information is going to be published on Friday, April the 17th. So that will give you a better information. And that's the website, so we'll pull the information and if need be, we can provide it to you. But bottom line, that's going to create a realistic picture of how this pandemic crisis has impacted San Joaquin County. Now, with the unemployment benefits, pretty much as you know, there's an additional benefit of $600 per week. And so that's going to be through July the 31st, and it'll last probably no more than 39 weeks. Now, the surge in the unemployment claims has definitely created an increase in complaints. And here's the list of some of the complaints that we had. Numerous complaints were about their UI checks not being received. Residents were calling and not getting a response. There was nobody answering the phone. There was disqualification of eligible individuals. And, they were not given any answers. And then they did not know how to reapply, And some of the corrective action that was taken by the state, first and foremost, they hired intermittent staff. They pulled all the job service staff from all the WorkNet centers throughout the state of California. So bottom line, they're not there and they haven't been there for 3 weeks. And they also pulled staff from LMID and other divisions so they could facilitate the processing of claims and answering the phones. Now, in their infinite wisdom, they were answering phones in the morning between 8 and noon, and they were processing claims in the afternoon from 1 to 5. Well, guess when everybody was calling? The afternoons, and nobody was there because they were too busy processing claims. So we met last week with all the directors of the state agencies, the State Workforce Development Board, the State Employment Development Department, Employment and Training Panel, and the Labor Agency. And we met with all the workforce development directors, so through a WebEx conversation, we talked about some of the issues. We talked about the national emergency grants. We focused on the stimulus packet and how to facilitate implementing some of those programs and accessing some of the programs, for example, for our businesses. Of course, we discussed the complaints, and one of the biggest concerns is that we didn't have answers, and we needed answers. So Jaime Gutierrez pretty much guaranteed that they were going to dedicate one person, to process all our complaints. So we elevated all the complaints to them, and they assigned staff to each of the workforce development boards. So we're going to send them the complaint so that they could look at it and then give us a response. But they're working, and part of the problem is that, in the process of gearing up, it took some time. The reinstatement of retirees, and rehiring of intermittent staff, what they lacked was the training. So part of the reasons they were determining people ineligible, they were applying the normal standards and requirements, and they hadn't been given an orientation on the stimulus packets and some of the exceptions. So some of the employers that are eligible for unemployment insurance, this program has not been set up. And it was going to take about 3 weeks to establish an office and the protocol so that these employers who are now eligible for UI will be able to apply. So it's probably, this is probably the 3rd week, so they should be processing those claims by next week. Okay. In terms of the rapid response activities, sorry. I lost focus of... Okay, sorry. We have received 36 warrant notice, and that was a displacement of about 2,760 individuals. Okay, and so one of the things that we initiated, we usually initiate the conversation with the employers, and we released an information packet. In the packet is a letter that identifies some of the resources and opportunities they have to access the programs from a variety of partner agencies, including ourselves. And with it has an attachment, which Kathy asked me to develop, that has all the links, the contacts, emails, and so it's a complimentary piece that's attached to them. That information is also on our website. So these employers could review the instructions and access a lot of the resources by just simply calling us or accessing our website. They are facilitating the delivery of information to the participants, the individuals that have been displaced. Excuse me, my mouth is dry. There's a great effort by these employers to, eventually bring back these employers, these employees and reinstate them into their position. So a lot of the orientations for rapid response activities are online, and employees are getting also, so the employers not only they're getting special instructions, but also the participants are being given instructions on how to facilitate the process. In the WorkNet centers, this is the list of the current employers that are hiring, and these are. And so from the list, we're looking at about a little over 1,800 positions that are available. And so we will continue to monitor and identify those employers that have a need to hire, because at this point they have the interest in hiring those individuals that have the skill sets from the clients that were displaced. Thank you. Okay. In terms of the delivery of services through the WorkNet centers, everything is done by an appointment. It takes an appointment and establish an interview, and we're using teleconferencing, telemessaging, telecommunications, and a lot of our services are available online. We're using WebEx to conduct interviews and orientations, and it simply starts with an interview. And once we start talking to the clients, they're given an orientation online, and they're given instructions how to facilitate and initiate the intake process. Our first and foremost priority is to support the active and enrolled customers, making sure that they have access to the resources and services, the services that would eliminate barriers to employment, and likewise, facilitate their transition to employment, including providing training activities. The other is, initiating the intake and certification process for new clients. And so once they contact us, if they're not ready to talk to us, then we'll schedule an appointment and we'll initiate the intake and certification process. We have all the information, orientations online, and we could certainly email it. We could send it to them. I mean, whatever choice they prefer, we will use that method of providing that information packet that walks them through the process, and at any time they are assigned a staff that can facilitate, going through the information. We're coordinating the coordination and the collaboration is well done. We're scheduling web-based meetings with all our partners, and again, we're using the same mode of communication by telephones, establishing protocols for that we have followed. So we developed a lot of policies and procedures, directives to guide staff on what to do and how to do it during this pandemic crisis. We're using a lot of tech messaging to communicate with our clients and making sure they stay on top of all the required activities that need to be done, including participating in interviews. And there's a lot of online services that are reinforced. In terms of the delivery of services to businesses, we're providing qualified candidates to meet the labor demands of the employers. We're filling job orders. We're doing a lot of direct placement. We even have on-the-job training contracts. Recently, we just signed some contracts. So this is an agreement where an employer can get a subsidy of up to 50% for 3 to 6 months. We're also doing private sector work experience agreements. And again, we're scheduling interviews via telephone and WebEx. The Economic Development Center is working very closely with business and helping them access the available resources. Collaboration is high between our partners. I think there's a greater interest in leveraging our resources and promoting our respective resources to make sure that we meet the needs of those businesses in crisis. And so bottom line, the business team San Joaquin, which includes the Economic Development Association, the Small Business Development Center, all the Chambers of Commerce, the San Joaquin Partnership, the Small Business Administration, of course, all the municipalities. We're all working together to share the information and deliver the essential services to our business that are under crisis. So all the information that is in that attachment, all the links, pretty much all of us have it. And we're sharing information about the resources that are under development. The municipalities are coming up with packages, for example, even loan packaging. And as that information becomes available, we have discussions, we discuss it, and we share those links so everybody has the links to the resources and we know who's providing what services. The Small Business Administration and their stimulus packet have two primary loans that we're targeting. And that's the Small Business Economic Development Injury Loan, Injury Disaster Loan, and it advances up to $10,000 to economically distressed businesses who has lost their revenue, and that loan will not have to be paid. So it's forgiven. The other one is a payback protection program, which includes a small business, includes for small businesses an opportunity to keep their workers on payroll, and that loan again will be forgiven if they keep all their employees. And the Small Business Administration also has the SBA debt relief, so they have the flexibility to provide some relief on some of the debt that is owed by these small businesses. The Small Business Development Center, as you know, it's co-located at the Economic Development Center and the Comprehensive Lincoln Center, and it provides assistance to the small business owners, and it has a variety of resources to support small business. It offers free and confidential business advice to the small businesses, and it's facilitating the access of the resources through the small business programs, small business administration programs that they have. So they will facilitate, walk them through the eligibility requirements and facilitate their submitting applications to the SBA for those two loans, the Economic Injury Disaster Loan and the Paycheck Protection Program loan. As you know, the San Joaquin County Board of Supervisors authorized the modification of our RLF administrative plan to streamline the loan process, to facilitate and enable us to provide the working capital and make the modifications to the loans to facilitate and support those businesses that are in distress. It also and it was submitted to the Small Business Administration, and it has been approved. We haven't gotten the official letter, but we have been informed that that administrative plan modification, the temporary modification, has been approved. I had also created the RLF's Emergency Business Support Fund, which will capitalize $600,000 from the RLF program, which will be available for loans of up to 75 for some of these business concerns that have a need for capital. We're strongly collaborating with our partner agencies and lending sources, which would include the Small Business Development Center, the Small Business Administration, and the municipalities. Our Business Retention and Expansion Program, the EDA's team is working with the small business to facilitate their accessing the need for resources, accessing those resources from our partner agencies, accessing the small business SBA's program that's come from the stimulus packet, and we're assisting employers to navigate through the eligibility requirements and providing assistance in submitting their applications. Kathy asked, what's the difference between furlough and a layoff? Well, a furlough, it's a temporary period in which the employer requires a worker to take unpaid time off. It's unpaid, but the employee, they're not separated from the employer, and they are able to continue receiving their benefits like health and retirement. Now, the employee is also eligible to apply for unemployment insurance during the time that they are off work. Now, the layoff is essentially a termination from employment. So that individual no longer has access to payroll and no longer has access or able to receive the benefits, but they do qualify for COBRA and Cover California. And these employees, are eligible to apply for unemployment insurance. And there's that first week that's waived so they could access the UI system immediately. Now, here's a letter that I was referring to. As we do the rapid response activities, as we initiate contact with any business, we're going to send them a packet. And that information will identify the resources that are available through our office and likewise some of our partner agencies. And it has that complementary piece that has all the contacts that you will find in our website as well as the websites of some of our other partners. But the bottom line, we will facilitate their accessing the available resources, and all they simply need to do is give us a call, and we will work with them. We have been, for the past 3 months, real aggressive in applying for competitive grants. So the only one we've received so far is the Workforce Accelerator Fund that will give us $150,000 to facilitate service delivery to the homeless. But we submitted 2 national emergency grants that we're going to get $487,500, and the other one is $450,000 to provide some disaster relief to the individuals that are displaced. One is a work experience opportunity, and the other one is an employment and training, delivering additional services to those individuals that are displaced. We also have the STEP program, which is going to provide $750,000 to provide work experience to students that have disabilities. We just submitted the $350,000 grant application for providing employment and training services. So those individuals that are distressed, this will be funding to help them get support, like, paying the PG&E bill and maybe their mortgage or their rent, just to get them through the period. With the Employment and Training Panel, we submitted an application under the Workforce Development Board to serve incumbent workers. We're pulling the money down to give it to the business community so that they could pay training. And so bottom line, they pretty much do the training up front, and then we will reimburse them using the Employment and Training Panel funds. Now, we did have one that we did it under the EDA, and so we submitted it for under $200,000 because that's kind of the threshold where it doesn't have to be scrutinized too much. And so we're eligible to expand it to up to $300,000. So we're asking for that additional $105,000. Both Employment and Training Panel agreements or contracts will probably give us authorization right around July 1st. So we'll be able to have those resources so that businesses have the funding to provide training to their incumbent workers. And so at this point, you're looking at about, $2.8 million that we hope will get most of that funding. And that concludes our presentation. Patty and Ed Wankett and Steve Landsberg is on the line, so we're able to answer any questions you may have.
I have a quick question on a lot of these, the unemployment, the enhanced unemployment, but also the emergency COVID, the $10,000 forgivable assistance for small businesses, and then also the payroll one. Do you know what? Is there a time? I mean, I have talked to so many people who applied for all of these within 12 hours of them being announced, and nobody's received any money at all. And for small businesses, that $10,000, that literally was a lifeline they were hoping to get. And then it ripples, because that means their landlords aren't getting paid their rent. They can't evict, and there's nobody else to rent it anyways, but it ripples through our local economy. Do you have any idea on what the timeline's going to be when our businesses are actually going to see some relief?
Yeah, well, the funding has been allocated, so the bottom line, until that money runs out, they have access to it. Part of the problem was the implementation. For the most part, initially, it was the small banks that were processing loans. And the big banks, they had to go through their protocols and upgrade their policies and procedures, so they took a little longer to get it started. The other issue was that they were providing these loans to their customers, and they were basically not providing services to anybody that was not their customer. So they were terms and conditions. So I think the feds got a little upset and sent a message to the banks that bottom line, they needed to open it up, not just to their preferred customers, but to the people that needed it in their community, i.e. these businesses in distress. So at this point, I'm sure they got a lot of applications, and now they're processing, but those delays pretty much are hopefully over and done with. And so I think the big banks are kind of focused on what they need to do, and the little banks continue to do the best job, So I think you will see more relief in the near future.
And on the unemployment, I know there was information that said if you were a small business owner, you were now eligible for unemployment, and that had not been the case. Do you know if that is actually being implemented? I mean, are people being able to access that?
Yes, what happened, Madam Chair, this was a new program.
Yeah.
That required to establish a new agency, new protocols, and it was going to take, according to the State Employment Development Department, at least 3 weeks to set it up. So while everybody was filing their claims, these individuals filed theirs, and the biggest problem they had is some of those individuals who came back, from retirement and previously were intermittent staff, well, they were processing it, and they disqualified these individuals because they were using the old eligibility criteria because employers were not eligible, but under the stimulus packet they are. So probably by next week, they will have all the protocols in place and they will begin processing those claims. Now, people have submitted claims, so what we're doing, the Workforce Development Boards, we're providing all the complaints to the State Employment Development Department, and they're going to give us a response, and they're going to prioritize dealing with those that we get. And so there's been an assigned individual to provide us that information. And so at this point, I think they need assistance in letting them know that there are complaints, and we want to we want to get the information. So as we move them up the chain, Jaime Gutierrez, which is the Deputy Director for the State Employment Development Department, has taken on the responsibility to get those claims from us and then delegate it to the respective staff, and then they're going to get back and provide us this information, or at least prioritize and find out what's going on with that individual.
Great. And does it matter how the small business is organized? I mean, do they have to be a sole proprietor? Can they be organized as an S Corp? Are there any restrictions on that, or is it just if it's your business and you're the owner, you can and you've been shut down?
Yeah, I think they all, small businesses are eligible.
Okay, that's very helpful. Thank you. Okay, that's helpful to let people know.
Yep.
Any other questions for Mr. Solis? Supervisor Patty.
Thank you, Madam Chair. Just a quick follow-up. Is the county helping some of the businesses that are not with loan banking institutions? Was I getting that from your presentation? Or are you just sharing what's available?
What we're doing is those businesses that are calling us, we're facilitating the process. They're struggling, navigating through the process, so we want to make sure that we walk them through the eligibility requirements, and we will assist them in completing the application. And we'll work with the Small Business Development Center, for example, and if we need to, we'll contact the Small Business Administration to facilitate the process. So it's not just providing information. The bottom line, if they have a concern, they should call us. And we will work with them. We will call them within 24 hours and send them the information in the packet. And then if they wish to work, if they need assistance, we will provide the assistance.
Okay, so a quick follow-up. Some banks, being a small business owner, some banks are saying that they've taken in enough applications, they're done, and they're going to wait list everybody else that comes in the door saying, I have an application and I want to proceed. So is it your... are you guys able to take that application and help process it, or are you directing them to?
So the application has to be submitted to the Small Business Administration.
Yes.
And they will process it. But we will facilitate the process, and we'll provide some technical assistance to assist.
So you'll submit it to the small business?
Well, we won't, they will, but we certainly will assist them.
Okay, so they don't have to go to a bank?
I think they're going through the banks, yes.
No, there's...
Yeah.
Again, some banks
are
banks are waitlisting, and they're saying they're full, they're not taking any more applications.
Supervisor Patty, can you hear me?
Who's that?
Steve
Blansberger.
The voice from the beyond.
Supervisor Patty, there's two things with respect to that question. First, the payroll protection program goes through the local banks or financial institutions. The EIDL, which is the Emergency Injury Disaster Loan, you apply directly through the SBA. So there's a distinction on how you make application for those funds. And the $10,000 advance applies to the EIDL, and that is forgivable. But again, the maximum loan through the EIDL program through the SBA is $2 million. So the payroll protection program, that maximum loan is driven by your payroll costs and other working capital costs. So they're a little bit different, and many of the banks, as was mentioned in this meeting, have shut their window on taking applications because they have met their volume cap with the current CARES plan.
Yes.
But there's efforts in Washington to increase that amount with another stimulus bill. Hopefully will open up some more funding opportunities to small business.
Excellent. That's what I was wondering, a little update on that. So it's going to depend on additional funding at this point.
And at
Correct.
this point, they were considering a possible stimulus or additional plan of anything between $350 to $600 billion.
Understood. Okay. Thank you. That's my questions.
But the one that's being shut off through the banks, that's the payroll protection?
That's correct.
So the other one that's submitted directly to the SBA, that one has not been cut off that you know of?
No, it is still, you're able to apply, but understand that there's quite a bit of documentation required for the direct application to the SBA. And they don't, at this point, there's been a lot of discussion across the country about they lack the infrastructure internally to process all of the applications. So that's why there's a delay in getting a word back from the SBA. So they're trying to ramp up staffing to handle the request, but many of the people that I talk to on a daily basis have applied to the EIDL, but they're still awaiting a response from the SBA due to the tremendous demand for that program.
Okay, thank you. Yeah, 'cause that's what I was hearing from people was, well, I applied right away, I worked my way through the process, it was accepted, and now I haven't heard a word, and it's been weeks. So this is helpful to know what it might be.
Supervisor Miller and Board, if I can just add to that a little bit. I got some updates earlier today. As far as the EIDL payroll, the EIDL advance part of the loan program, the SBA has limited the forgivable part, the $10,000 advance. That is now limited to $1,000 per employee. So if you have 5 employees, you'll be approved for $5,000. You get to keep it. There's really no circumstances that would allow you to have to pay that back. There was some discussion in the last couple of days that the SBA limited that loan to $15,000. In fact, some of the SBA staff had actually said that. So if you talk to anybody about that one, they actually are leaving it at a $2 million limit for each business, and that's based on, like Mr. Landsberger said, on their payroll. Generally, they look at 2 months worth of payroll, average payroll, to decide how much that loan will be. As far as the payroll protection program, that one, as Mr. Solis and Mr. Landsberger said, they're trying to get more money for that. As of yesterday, they had 750,000 loans approved nationwide for a total of $187 billion. So that's over half the money so far, yet I have talked to no one. The question that you asked right up the bat was the same question I get about 20, 30 times a day. And there's not a single business I've talked to in San Joaquin County or outside that has gotten the loan yet. And again, as Mr. Landsberger said,
they're telling people that they're only taking applications from people that are already customers at their bank. And again, some of them have already limited, cut off any applications. However, we want to encourage them to continue to apply. The SBA seems quite confident that that the number that is allocated for both programs is going to go up, and it's just a matter of time. Now, time for small business can mean a lot, so hopefully it's a lot sooner than it is later.
So the EIDL, that's also tied to payroll? That's not, so if you're a sole proprietor and you want to submit simply for your overhead for a couple of months, that's not eligible? It's tied to having employees that you pay?
Yes and no. It is, if you're a sole proprietor, then you can apply for it. It's a very simple process that you never ask for an amount that you want to borrow through this program. You're going to go through a very quick application process, whether or not you're eligible for the loan, and then simply check a box on whether or not you want the $10,000. And then it goes off to the SBA. SBA will determine how much they are loaning through this program based on twice the average payroll for that company. So if you're a sole proprietor, what was your average income for 2 months from I believe January 1st, 2020 forward? The payroll protection program, the total amount of that loan will be 2.5 times a company's average monthly payroll. So you can kind of figure out there what you're going to get from them if it's approved. I did hear last night that the money for the payroll, the money for the EIDL advance is supposed to start going out tomorrow. So we'll see if that happens. Has anyone here applied for it or know anyone that's applied for it?
I know someone that's applied for it.
So we'll see if that happens.
Madam Chair.
Yes.
Just a quick follow-up. And by the way, Mr. Solis, Mr. Wankett, and Steve Landsberg, I appreciate how hard you guys work on behalf of our business community and those here in San Joaquin County. You're all really dedicated. On the payroll protection, I do know some companies that did receive funding and quickly here in San Joaquin County. And the irony to it is there are some companies that have suffered some real hardships due to the current situation, and others that are actually essential businesses. Their revenue stream is as high as it's always been, and they just got a payroll check that's worth a lot of money, and they're not suffering any losses. So it's there's a little loophole there that's there's some people that are getting a big bonus check that aren't really going through hardships.
Yeah, and for them, that loan will be forgivable because they will have the same amount of people employed in February as they will at the end of June of this year. That's how they determine whether or not it's forgivable. If you maintain the same body count, so to speak, through June 30th, then the loan is forgivable. If you have less than what you started with, then it is tapered down by a certain percentage.
What you may want to do is contact your associates in Washington, D.C., and if your revenue stream has dropped and you're keeping your payroll up and you're maintaining that employment level, that's where I think that money was intended for, versus somebody that's getting all their revenue stream as normal, there's no decline, and they're now getting a big boost.
Yeah, and that works for the EIDL too. There's a lot of people out there that are saying, hey, $10,000 for free, why not? I'll apply for it. Yep. So hopefully that's limited, and the people that really do need the help are going to get the help.
Great, thank you. Any more questions? Okay, thank you very much.
Thank you.
Last person I'm going to call up is, if the sheriff wouldn't mind, Sheriff Withrow. This is mainly just for the public. I know you were talking about it yesterday, but there's a lot of concern about jail releases.
Yeah.
And I just thought you might want to update the board, but also provide some information for the public that's listening.
Yeah, absolutely. I appreciate the opportunity, Madam Chair. Yeah, we should be done about now. We had a deadline of yesterday that got extended into yesterday evening. So we've been ordered by the state of California, as have all jail facilities throughout the state, to begin releasing inmates under zero bail. That means we had to go back, and we have approximately 1,230 inmates in our jail. This affected unsentenced inmates, so that's about 2/3 of our population in our jail. My records division has been working the past week going through over 900 files individually by hand, looking at each charge, each subsection of that charge to find out whether these folks now qualify for what's called zero bail. So when you're arrested, there's a bail schedule. There's a new one now, but a bail is usually set to the crime that you've committed. It's been set by the courts, and that can range from millions of dollars down to hundreds of dollars. And what the state has done is gone and picked 13 categories of violent felonies and excluded those from the zero bail. Now, of course, each one of those categories of those 13s have hundreds of subsections to them. And then everything else basically has been zeroed out down to zero bail. So anyone who was booked in before this took place, we had to go back and find out now whether they were eligible for this zero bail. And our local court decided to assign that to my custody staff and my records clerks, who, believe it or not, are not legal scholars and have not been to law school. And we always get a little nervous when we start trying to overrule or change what a judge has done. So luckily, District Attorney Verber assigned Christine Reed to help us, Deputy DA, and she was amazing. She was on the phone with us for days, hours long each one of those days, helping us to get our way through that, along with some judges. And all the way down to at least 6 o'clock last night, it kept morphing into these different decisions on different subsections of different laws, and but our staff kept working, and we got it down to about 65 to 70 folks that we were releasing out of our jail. There's still another 100 that we have set aside that the judges are looking at to try and determine whether they're eligible also or not, and if that. We heard about all the numbers today and how we try and judge that. We would think that might include another 10 or so people out of that will have to go. And then there's the people at our jail that were included in this that were mentally incompetent to stand trial. And we were very upset about taking somebody who's mentally incompetent to stand trial and putting them back out on the street. And so now at I think 1:30, they're going to start holding hearings on those cases, or at least the judges are going to start reviewing those to see whether they're going to be released or not, or what they're going to do with those, and they'll advise us on that. It's something that I've been very vocal about, that I don't think we needed to do here in San Joaquin County. As you know, I've come before you and told you all the great work that my staff has done to keep COVID-19 out of our jail, and how it was actually safer for the inmates to be in there and have their medical facilities and have 3 meals a day and have a place to stay. And now we're forcing these people out of the jail because of this blanket order that's been put across the state of California. And I think we would all agree, anytime, whether it's discipline or anything else, that you do a blanket order for everybody instead of looking at individual cases to determine what's best, it usually doesn't go well. So when I heard this was going to happen, I called for an emergency meeting and asked all the chief of police to come. They did, along with the DA, to our office to discuss this. And then we talked about the COVID virus and everything that was going on with that. And then when I heard about these releases that I was ultimately going to happen, I picked up the phone and called each one of them individually and informed them that this was coming back into our community and to be prepared for it. And I apologize that I wasn't had the ability to do anything to stop it, but they were very supportive and understood. And now we're all working together to deal with this. As you know, at our jail, we're kind of trendsetters there. We have this assessment in place when people come into our jail that they're put through this assessment as to whether they're eligible to get out or not. And I'm not sure if anybody else is doing it, but not very many, if any, are doing this. So we're kind of a trendsetter in that. So the ones that should have been out and were not a risk to society and have the opportunity to be out were already out. And so to add these folks to it, they're most likely going to reoffend, come back to our jail. Of course, this time when they hit the door, depending on what they do, there'll be zero bail. So I won't have to get them back into our population, most likely, but we'll have to see what reoffense they do, if they do. And we'll continue to try and keep that virus out of our jail. And all the chiefs of police and I have adjusted our schedules and things like that, and the people that we have out on the street, our staff, to be prepared for this and to continue to protect the people of San Joaquin County with every fiber in our body that we're out there. And I was out working on Easter Sunday with our guys, and it's going well. The public is heeding what they're supposed to do as far as stay in place, most of them, and ones that we have to address on issues are being responsive. So we're happy about that. We have not seen, I believe I sent an email to Supervisor when we addressed it last meeting. Somebody did. And we personally in the county have not seen a spike in our violent crimes or domestic violence and things like that of people staying at home. Maybe in some of the cities in our jurisdictions they have, I'm not sure. But we're being very proactive out there, law enforcement wise, to make sure that people know that this is not the time to challenge us. And there are some laws that are still in place that we can use to, everybody knows about looting during a time of emergency. Well, anyone who commits a felony property crime during this time that meets certain standards, we can charge them with looting under this. And the DA has graciously said that, yes, she will absolutely go after those folks who will try and take advantage of this situation. So there's a lot going on, a lot of moving parts, but we've got the best law enforcement, I believe, in the country here in the state of California, especially here in San Joaquin County. So we are working hard to make sure that although we don't agree with this, that we will make sure that it is not too impactful upon our community.
Thank you. And I know, and you may want to speak to this, there's a lot of folks out there right now that are out of work.
Yes.
And are desperate. I had my 85-year-old neighbor grocery shopping at Lincoln Center and had her purse snatched.
I saw that.
Yep. And she said one other senior lady had her purse snatched the same time. This is right in the middle of the afternoon. She was just distraught over it. And there's just a lot of people out there right now, so we all need to be extra vigilant and look out for our neighbors, especially our seniors who are really struggling with a lot of these rules, and it's a lot for them to remember when they're out.
Absolutely. You know, desperate times make people that normally may not do bad things do desperate things, and we understand that. And that's why we want all of us in the public safety and first responders and everyone, we want people to reach out to us and let us know when you're in need. There's so many people out there that, again, we talked about last time turning a negative into a positive, and we are seeing so much of the good side of people through this crisis. And people just need to let us know when they need help. If they don't have food, if they don't have shelter, whatever it is, I know this board and everybody who works for the county, whether you're first responders or working in hospitals, private hospitals or county hospitals, we are here to help. So just please reach out and ask during this time, and we will do what we can to find you help. And you will see this community respond anytime anybody needs anything. So, but you're absolutely right. They have to be extra vigilant at this time because the wolf is at the door, and they're willing to take that step when you're not looking. So.
Yeah, I really am trying to recommend to all the seniors that I'm in contact with, take advantage and grocery shop at those stores that offer a special hour of the day just for seniors.
Yes.
Because there aren't as many people there, and everybody there is a senior, and they tend to look out for one another a little bit more. So I'm trying to recommend that, but it's really hard for a lot of folks. So thank you very much. I know the public was asking a lot of questions. Any other questions for Sheriff? Supervisor Patty?
Yes, thank you, Madam Chair. Quick follow-up to that point. There are not a lot of places where there's a lot of retail activity, and stores are one of them. Do we have a presence? Is there any visibility that would give people some comfort, since we've had 2 cases yesterday alone? So just curious in that Lincoln Center area, which during the holidays you guys oftentimes are there.
Absolutely. We're trying to have as much presence as we can between calls for service and presence that you can't see. I know myself and the rest of my staff, you may see us standing outside our car, eating off the trunk of our car sometimes there, or you may not see us at all in our unmarks that are running through there. So we try and be there as often as we can, because we have to go between calls for service, and not just that area, but all the other areas through our county where business is still open, and around the ones that are closed also, just to make sure that we're trying to prevent crime from hitting there also. So we do have extra staff. We have up to, normally our patrol staffing is very, very challenging at this time, but since we've broken it up into this emergency staffing that we have, we're having anywhere from 12 to 16 officers on at a time on a shift. And so everybody's going to be in uniform, but the unmarked guys will still be in their cars, so that we can lay back and watch and make sure people are safe. So we're trying to have both of those.
Would there be an opportunity for Supervisor Villaputo to maybe be undercover, kind of like a Starsky and Hutch type of scenario?
Well, that would be an interesting combination, but you are more than welcome to come ride with a professional and watch what we're doing, but probably safer for the community if both of you stay on the board here and handle it that way.
Well, I just want to compliment your leadership and the entire department at San Joaquin County sheriffs and all of your deputies and staff. They are the county's finest. So thank you for the great job you guys are doing.
Thank you very much.
Thank you.
Thank you.
Thanks, Sheriff. Before we go to board comments, I just want to do a little follow-up on some questions we got. Ask if there's been any other members of the public that have called in that we need any questions to address?
We do have additional public comments. One of them is from David Angelo. This is the gentleman who sent in an incomplete comment earlier. He writes in and says, "Hi, my name is David Angelo. Sorry about the last email, as I am technically challenged. I am emailing you this morning to petition for the Manteca Clinic to stay open, please. Since the Manteca Clinic has been open, it has been so much easier to get rides to Manteca, and have been able to keep all of my appointments since at the Manteca Clinic. I am so thankful for their services and their staff there, and I am begging you to keep it open. Thank you." And Mr. John Beckman from the BIA, he asks, when will the language of the new San Joaquin order about to be adopted become available to the public? And I'm not sure if anybody's available to answer that.
There's a press release that's already been prepared that will be updated following this meeting, and it'll go out as part of that press release.
Great, thank you. And for Mr. Angelo, the board did take action that clinic will not be closed until at least June 30th, and the board will be taking a look at the clinic closures prior to that time.
And we also have a couple of comments from Barbara Berrigan-Perea again regarding Mr. Davis's presentation. She indicates that demonstrated that we do not have good data for the entire county. 35% of Stockton is under the age of 25. The population is younger than in San Francisco. Half the cases are in Stockton. She goes on also to ask the board to consider using GoToMeeting. It is what we use for meetings and is more secure. State agencies and regional agencies throughout California are using an array of services for enhanced citizen participation. This process does not allow presently for best participation. We know you are trying, but if this is long-term, there needs to be enhanced meeting capability for democracy purposes. And I can speak to that a little bit, Chair. I am reaching out with ISD to see if we can provide the option for all department heads to participate telephonically, so that our department heads can start participating live in these meetings. And then I've also asked if there is a way to look at options for public participation during the meeting that's more interactive.
Great, thank you.
And then we also have an anonymous comment. Will there be any consideration for a pay differential or perhaps ability to earn admin or comp time for those essential employees who are working with the public versus those who are able to work from home? It does not seem fair that my colleagues and I are working with the youth at juvenile hall and others are allowed to stay home, and we are both receiving the 5%. We are putting ourselves, children, colleagues, detained youth, and families at risk daily. Juanita Lamb writes in, let's listen to our public health expert and keep the golf courses closed. The board should be focusing on more essential aspects of controlling the spread of the virus and keeping our community healthy and safe. Yes, all jobs are important, but the singular focus on golf is outrageous in the grand scheme of things. And an anonymous comment writes in, I play golf, but I think the board needs to back off on the golf courses. They say that it's hurting people that work there having to work 2 jobs to make ends meet. What about people in other industries who have to do the same? We need to shelter in place as mandated and stop worrying about the golf. We'll live long enough to play another day. And then Ioana Dement asks, Dear San Joaquin County Board of Supervisors, as of this date, can you please whether or not residential real estate is now an essential list? Thank you.
Thank you. And the information on that is going to be in the press release this afternoon. I have a couple of follow-up questions, and I think probably to the CAO. One, we had a question earlier on the 5%. In terms of, is it available to every employee who is currently working because they've all been deemed essential? Or is it only available to some of our employees who are currently working?
Madam Chair, we have given that discretion up to our department heads, and it is for essential employees and those employees that are working. So I cannot say that if an employee is at home and they're conducting non-essential services, whether or not that 5% has been given to them. But my understanding is the majority of the employees who are working are receiving the 5%. So if, say, for instance, somebody's at home and they're being paid their salary under HR 6201, that's considered not working, and they are getting paid, but they are not receiving the 5%.
Correct. They have to be engaged in work where they're responsible for deliverables and reporting, and they are actually on the job.
That is correct.
Okay. Thank you. Any other questions before we move on? Then this is the time that the board, you have the ability, if you care to highlight someone either in your district or just in the community that's sort of going above and beyond, sort of a local hero moment. So, or if you have any other board comments. So, Supervisor Villaputa, any comments?
Yeah, I'd like to recognize my Chief of Staff, Christopher Pay. He's been working tirelessly, going through homeless encampments with our DA, Verber, and he's been trying to help the homeless, check their temperatures, and he's done a great job of really getting involved in the community and trying to help find out if people are sick or not.
Thank you. Supervisor Patty?
Thank you, Madam Chair. I was actually going to recognize also our district attorney, Ms. Verber. We participate in, and at the same token, United Way, and the many participants that twice a week they're meeting and they're working of how to help and save some of the impacts that are happening in the community and lessen the degree, especially as it relates to the homeless people, handing out backpacks and just getting out and being boots on the ground and instrumental in all of the efforts. So I want to recognize our Ms. Verber for all of her action, all the work and the collaborative efforts that are put together through United Way and Kristen Birtwhistle and the whole team over there. So do an outstanding job. Thank you.
Supervisor Wynn.
Well, I had mentioned last week in regards to Bread of Life, and I was pleasantly surprised because they assemble at my house going south to Modesto or San Luis County, and also even some in Merced. And lo and behold, last week, an officer I used to work with showed up, and he lives in Turlock. But he had heard of the need, and because obviously he's in Stanislaus County, he showed up with 3 of his teenage grandchildren. And the reason I bring that up is because, as I said before, I think this is an opportunity and maybe a teachable moment, so to speak, for our youth and certainly for our community to really show how much they care for those who are desperately in need during this time. So, Marcos Rivera is his name, but he's great guy, very involved in youth athletics, et cetera. And so it was nice to see him and certainly his grandchildren. And he's back. He's been back a couple of times since.
Great. Supervisor Elliott?
Thank you. I would again like to just highlight all the efforts of everyone in the county who has worked so hard to flatten the curve, make our county conditions safer and more healthful, and also for those who are now looking to the future and looking for ways that we can get our businesses open, get our people back to work in ways that protect the health of the citizens. So again, great job, everyone.
Thank you. And I want to highlight today Pastor Joey Steelman on the Lord's Gym City Center and Oasis Cares Food Pantry. Pastor Steelman operates a gym and an after-school community center on Hammer Lane, a very large one. And they have a lot of youth there every day. And they almost immediately switched gears when they weren't able to have their regular programming. And they started doing drive-through food distribution from their food pantry there. So folks drive in, they just ask them to have their trunk cleaned out. And he and a whole bunch of volunteers, including a lot of the youth, carry the bags out. They load everybody's car up and off they go. In just the first week, they provided food to over 11,000 families. So I think it's a great example, just what Supervisor Wynn and the rest of us are saying, that people stepping up to really care for their neighbors, and it is providing a lot of really wonderful teachable moments for a lot of our young people as well. So thanks to all the folks throughout the whole county that are really going above and beyond to keep everybody safe and take care of one another. So we are now adjourned until next Tuesday at 9 a.m. here in our chambers. Thank you, everybody.
Can I just make, in regards, I pulled the board letter, and it's very clear that the authorization for the 5% pay, because I know it's come up as for more than one comment, is supplemental pay for all hours worked during the public health crisis to essential employees only. And it's effective March 30th through the pay period ending May 24th of 2020. So it's essential employees.
That's great. Thank you very much. And then we also had one of the public comments that came in regards to behavioral health services. How are we delivering them? How are we gearing up? Are we still partnering with our CBOs? How are we providing all these services? Maybe if we could schedule at our next update something from Mr. Vartan and Greg Diedrich in terms of behavioral health, how we're switching gears in that case and continuing to provide services. I think the public would like to hear about that.
We will be prepared to do that.
Perfect. Thank you.